Honorary Secretary Vicky Flo would like to extend a warm welcome to our revered guests, Dr. P. Raghuram, Ms. Chavi Mittal, our eminent past chairs, and distinguished members. We would now request everyone to please rise for the national anthem. I request the photographers to refrain from clicking during the national anthem.
जनगण मनाधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल वंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जनगण मंगलदायक जय ही भारत भाग्य विधाता जय हे जय हे जय हे जय 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 जय
I now request our illustrious guest speaker, Dr. P. Raghuram, Ms. Chavi Mittal, Chairperson Ms. Shubhra Maheshwari, Dr. Jayashree Sharad, Past Chair Ms. Monica Agarwal, Past Chair Ms. Rekha Lahoti, from the audience and members, Ms. Ananya, Ms. Lalita, and Ms. Vidya to step forward for lighting of the lamp. Requesting Ms. Sonali Saraf to join us for the lighting of the lamp as well. Requesting flow and by-flow past chairs for a picture, please. Core committee to come in next and all other power riders to join in for the picture.
I can request you. Sir, with your permission, please. Thank you. Just a second. With your permission, sir. Thank you. Just a second. One more, please. Thank you very much.
requesting our esteemed guests, Dr. P. Raghuram, Ms. Chavi Mittal, and Chairperson Ms. Shubhra Maheshwari, to grace the dais. I now request Chairperson Ms. Shubhra Maheshwari to felicitate the speakers, Dr. P. Raghuram and Ms. Chavi Mittal, with the floor memento. I now request our Chairperson Ms. Shubhra Maheshwari to address the gathering.
Thank you, Gunjan. Good afternoon, everybody. Thank you for taking out time from your busy schedules on the Monday afternoon. It was not a very thought decision to make it on Monday, but there were a lot of parameters and a lot of speakers coming in, and hence the Monday. So, to begin with, what's your address? Would you be in Banjara, Jubilee, Kukatpally, Sikandrabad? No, I wouldn't say so. Your permanent address is the body in which you live in. Hence, take care of it. And that is the seed for thought from where we envisaged a health and fitness drive for our members. Historically, women have been the primary healthcare providers and health decision makers for the family. You eat a pizza, the rest of the family eats a pizza. You decide to cook oats, and the rest of them eat oats. We are the health bearers, the torch bearers of our family. And when we take care of our health, that is when the entire family is motivated to look after themselves. There is nobody else who can take care of ourselves more than ourselves. So, ladies, be at it while we are at it. Before we proceed further, I would like to highlight a few of the activities at Flow Hyderabad. Our health and fitness drive began with the Superhit Badminton League, which saw participation, competition, sporting spirit, and most importantly, bonding between our members. The tournament was played on Saturday with 50 participants of all ages and skill levels, giving all their might, and culminated in them receiving medals and encouragement from PV Sindhu herself. There are players who've been on the field for years at end, but they don't get this opportunity which Flow members who participated did. We also had a five-part empowerment series on pan-India basis under financial literacy. The workshop includes topics such as money as a tool to design your dream life, equity, mutual funds, retirement planning, planning for taxes. We are done with 3 sessions, 2 more sessions. These are online. Pan-India members are making use of those. I'm assuming that Hyderabad is also taking use of these. Quest for Best Initiative has conducted career counseling for more than 200 students, girl students at Indra Priyadarshini College, Government College. The students had a lot of, we all need navigation, and these students from government colleges need the most. And hence the team Quest for Best, headed by Radhika Agarwal and her subcommittee members, ensured that these girls get the right guidance in terms of choosing the career options once they pass out of the degree college. The Seed to Succeed team has launched a full-fledged computer lab at the Mahbubia Girls Government High School, 15 computers, tables, chairs for the girls, 600 girls studying in that school. And on Children's Day, the team took one step forward and installed a library in a government school at Kachigura. A workshop on good touch, bad touch, sensitization was also conducted in 3 schools to spread awareness. And a very important announcement, please save your dates for Flow's annual business awards that are being closed on January 11th this year. We are immensely happy and proud that the initiatives and programs that we conduct have lasting effects for children, adults, and our members, and are making us stronger for the future. As I've always said, it's better to prepare than to prevent. It is better to prepare and prevent than to repair and repent. Ladies, take care of yourselves, because when we take care of ourselves, we can take care of others. Together, we are in this journey of health and fitness. She is us. Thank you so very much.
Thanks a lot, Shubhra, for this insightful address. Let me now introduce our speaker, Dr. P. Raghuram, a world-renowned surgeon Dr. P. Raghuram relocated to India from UK in 2007 when his mother was diagnosed with breast cancer. Over the past 15 years, he has revolutionized the breast cancer care in the country through a number of innovative initiatives. Distinguished academic track records, love for motherland, and passion for social service have been his trademarks. A recipient of numerous prestigious national and international awards, he is one of the youngest surgeons to have conferred with Padma Shri and Dr. B.C. Roy National Awards by the Honorable President of India and officers of the Most Excellent Order of British Empire by the late Queen Elizabeth II. Welcome, Dr. Raghuram. I now request Ms. Mansi to come on the dais and introduce our next speaker, Ms. Chavi Mittal.
An actor, model, speaker, singer, blogger, YouTuber, Chavi Mittal dons many hats. A performing singer since the age of 7, she holds a degree in English literature and a master's in Hindustani classical music vocal. She is currently making waves with her YouTube channel ventures, Shitty Ideas Trending, along with her husband, Mohit Hussain, and Being Woman with Chavi, which is everything about women entrepreneurs and go-getters. She was diagnosed with breast cancer, but the go-getter stopped at nothing. She gives her 200% in everything she does and continues to make the most of life, one day at a time. Flow Hyderabad welcomes Chavi Mittal.
Thank you, Mansi, for this wonderful address. Now I would request Chairperson Ms. Shubhra Maheshwari to take the session forward.
Good afternoon, Dr. Raghu. Thank you for sparing time for all of us. I would now invite you to please start the session.
Good afternoon. Shubhra Maheshwari, Gunjan Sindhu, the Executive Committee of Flow, the distinguished past presidents of Flow, and the Flow members here. Gratitude is the best attitude, and I'm very grateful for this opportunity to come here and participate and share some of my thoughts. And this is the reason I'm here. This is the reason I'm standing in front of you. My mother, who was diagnosed with breast cancer in 2002, precisely 20 years ago, which brought me back to India. And over the past 15 years, I've been striving to the best of my abilities to be a living bridge between the UK and India, trying to replicate the best of British practices in Bharat. So I'd like to begin by saying that there's a fine line between advocacy and scaring people. Certainly, Chavi Mittal and me are here not to scare anyone. We are here to empower you with the necessary knowledge. But I must say that breast cancer is an epidemic. It's a tsunami in our country too. It's the commonest cancer affecting women in our country. And it's also a fact that the vast majority of women in our country are diagnosed at a young age. Between the ages of 40 and 50 is the peak, whereas abroad the peak incidence is between 60 and 70. When I was working in the UK for the 10 years, I would rarely see, not rarely, I would say uncommon, to see somebody diagnosed between 30 and 50. Here, every day, I see women between 30 and 50 being diagnosed with breast cancer. It's a closet issue in our country. Due to lack of awareness and absence of an organized screening program, more than 60% present in the advanced stages. And this is somebody from our city who comes from Banjara Hills, but because of the taboo associated with the disease, she presented with a locally advanced breast cancer. And that's why every 8 minutes, a woman succumbs to breast cancer in our country. And we need to change this. And from time to time, all of you are aware about these monuments and buildings. Chavi, probably you're not aware. Several monuments and buildings turned pink in October. The only city in Asia Pacific region over the past 10 years where multiple buildings turned pink to create awareness about early detection. So, The first thing is, a lot of times I'm sure many of you will feel that if there is a lump in the breast, it must be cancer. The answer is no. 9 out of 10 lumps or breast health issues are not cancers. Only 1 out of 10 is a cancer. But how does one know whether the lump is a cancer or not? It is triple assessment. So if you go to a doctor with a breast health issue, if these 3 things are not done, then you're in the wrong place. The triple assessment requires a surgeon, a radiologist, and a pathologist. Just as the physician requires a stethoscope to diagnose any breast health issues, however good the surgeon may be, if there is no equally good pathologist and radiologist, one cannot do this triple assessment. That is, we get a diagnosis without the need for the lady to go under the knife. So in this day and age, if someone has a lump and if they are told to come and then come to theatre that they would do an operation, they are in the wrong place. So the triple assessment, the first component is talking to the patient. Naturally, patients get upset in our country, unfortunately, because counseling is not taught and it's not a priority for doctors. You find very often the doctor here, you can see, talking down to the patient. The patient is sitting at the edge of the bed or the chair and she's unable to express herself. That is what you need, a doctor who listens to the patient, who looks at the patient, who talks to the patient, who smiles at the patient, who comforts the patient. That is what is required in the first go. That's the first component. Second component is imaging, which is an X-ray of the breast, which is a mammography and an ultrasound scan of the breast. The third component is a biopsy. We always take a picture, so that's the lesion. We put a needle under ultrasound guidance so we can show the patient, look, this is a lump. We have taken the biopsy from that lump. So these 3 things are essential. You will very often come across FNAC, the words FNAC, the doctor did an FNAC. FNAC is given up. FNAC is fine needle aspiration cytology, where a needle is put and some cells are taken. That used to be the case 20 years ago. In this day and age, if there is a solid lump and the doctor does an FNAC, you are in the wrong place, because FNAC can go wrong. You can get false diagnosis and you can be reassured that there is nothing, and it also gives inadequate results, so it won't give a confirmatory many times. So what is required when someone has a lump in the breast is an ultrasound guided core needle biopsy. That's also a needle biopsy, but a tissue is taken, and that is the difference between a fine needle and a core needle biopsy. I don't want to go into the medical literature, but that is the evidence established in 1999, 20 years ago, that FNAC is given up. But even today, even from big centers, people get FNAC done. So FNAC should not be done. Core needle biopsy should be done. And then coming to some of the common myths and facts relating to breast health. So how many of you think breast cancer presents with pain? Could you raise your hands, please? Okay, I'm very happy. Majority of women with presenting with breast cancer don't present with pain. Pain is a very common symptom and it is not a sign of breast cancer. All it requires is a triple assessment, which I've told you, reassurance, reassurance and reassurance. Sometimes wearing a correct fitting bra helps, and very rarely some medications are used, but certainly not this medication, which is very commonly prescribed. Evening primrose oil does not work. Several randomized controlled trials over many years have shown that this is a placebo drug, never works for breast pain. So I'm just going to touch upon some of the issues just to empower you about the basic facts. Fibroadenoma is a common condition that occurs in young women, and it presents with a lump in the breast and it grows slowly, and what is required is not surgery. Surgery need not be done for the majority of fibroadenomas unless it is a large size causing discomfort. Unless it is that kind of a scenario, excision is done only when it is over 3 centimeters. It's very distressing to me as a clinician to find, this is an ultrasound picture, young women presents with multiple small lumps. They're already scarred. They've undergone surgery. They're disfigured. These are young 20-year-old, 22-year-old. And it bothers me that, a doctor should not be putting the knife on the skin in such patients who have small lumps which will not harm that lady for the rest of her life. Yes, we sometimes come across lumps like this, a reasonably young woman. You can see the right side is completely, right breast is completely occupied by a large fibroadenoma, which is a benign condition. And this is a patient who, the ultrasound probe even doesn't fit on the breast. And she has been advised to have a mastectomy because it occupies the entire breast. But in this day and age, it is possible to conserve the breast with what is called oncoplastic techniques, where we reshape the breast by excising that large lump you can see here occupying the entire breast, but reshape the breast. This is the immediate post-operative view where we can conserve the breast. So just because someone has a large lump, it doesn't mean that they should have a mastectomy. Breast cysts, very common in perimenopausal people. Suddenly notice a lump in the breast. Sometimes it can be painful, and what should not be done is unnecessarily putting a needle. There's no need for a needle test in that. It's very clear cut on ultrasound scan, and unless it is infected, we don't need to aspirate this. Only time we would aspirate or rather do a biopsy is when there is a lesion within that cyst, but it is very, very rare. So this is very common. My mother had breast cancer at 55. I must be at an increased risk because of family history. How many of you think that this will be an increased risk factor? Yes, I thought so. The answer is no. The reason is familial breast cancer, that is a cancer that occurs because of an abnormality in two genes, BRCA1 and BRCA2 genes, can cause breast cancer, but it's only 5 to 10%. So who is at risk? Not just because my mother had breast cancer. When someone's relative, immediate relative, has had breast cancer under the age of 40, or there are 2 or more relatives who have had history of breast cancer within the immediate family, or close relatives who have had breast cancer and ovarian cancer, and male breast cancer within the immediate family. Yes, men also can get breast cancer, but rare. In this situation, there is a possibility for them to carry this BRCA mutation. In general, if you look at women as a general rule, about 10 to 15% of the population do get breast cancer at some point. But those who carry the BRCA mutation in the category which I mentioned just now, the risk is 50 to 70%. Similarly, ovarian cancer risk in the general population is 1%, whereas those who carry this BRCA mutation, it's about 40 to 50%. That's just a perspective I was giving to you. So when someone is in that high risk, there's no need to panic. It's not necessarily that they will carry the gene. Genetic counseling is required before even doing the genetic test. It's not just good enough going to a diagnostic center and doing the genetic test, but it's important to talk to a doctor. Birth control pills, do they cause breast cancer? The answer is no. Modern day birth control pills do not contain enough estrogen and progesterone to cause breast cancer. But does HRT cause breast cancer? The answer is yes. Therefore, it is recommended that even if someone has to be given HRT, hormone replacement therapy, after menopause, it should be for a short-term basis, because prolonged use, particularly with the combined, will cause increased risk, and longer than 5 years increases the risk significantly. What about mammograms? Mammograms, do they cause radiation risk? A lot of times women, they say, doctor, I don't have a lump. I think mammogram causes radiation hazard. And the answer is no, because the radiation dose from a mammography is equivalent to a dental x-ray. So the benefit of getting a screening mammogram, that is an x-ray of the breast, once every year from the age of 40, far outweighs any risk, any radiation risk associated with mammography. And in this day and age of digital mammography, 3D mammography, the radiation is far too less. The second reason why women hesitate to go for a mammogram is it's painful. They say it's painful. It causes momentary discomfort, but if the radiographer is trained, for example, in our centers, many times women come to the mammogram, they don't see the doctor. So we train our radiographer to counsel the patient, to calm down the patient, because many times the patient is very anxious. So that is the first thing to do. Second thing is, if your radiographer is trained well, then the risk of pain is very less. It's only momentary discomfort. So the risk of radiation is not there. Pain should not be there. It should be only a momentary discomfort. Underwire bra and deodorants, do they cause breast cancer? Answer is no. Pregnant women, do they get breast cancer? Yes, they can get breast cancer. Particularly in pregnancy, the breasts are very dense, they're very nodular, they're very lumpy. So it's very important. Any new changes, persistent changes, they must report to a doctor. Breastfeeding, can it prevent breast cancer? Answer is it does not prevent, but it significantly reduces the risk of developing breast cancer. And this is something that we must all emphasize always. So breast screening, is it effective in all age groups? Answer is no, it's only effective from the age of 40. Why? Because in young women, the breasts are very dense. And when a dense breast is, a mammogram is done, it looks white. The cancer also looks white. Therefore, screening purposes, it is not effective under 40. It's only after 40, once every year. So why have breast screening? And the common question is, I don't have a lump, why get the breast screening done? Why is breast screening done? Is because if someone gets a mammogram annually from the age of 40, one can pick up cancer many years before the lady or the doctor can feel it. And if you pick up cancer so tiny in few millimeters, we can expect to confidently say, normally in cancer you don't use the word cure and things like that. You would say, yes, nothing will happen to you. Your old age, will take over you. And we can say that when you're diagnosed with a screen detected cancer. I'm talking about very small cancers like that, few millimeters in size that you can pick up on annual screening. So how do we diagnose it? We do a biopsy under mammographic control. What do you do when it's diagnosed? Because I can't feel it as a surgeon. We put in a fine wire and then we excise that lump with a normal tissue. And after the tissue is removed, we send it for pathological examination. This is a lady who came to us from the US. She had a marker clip there. As you can see, small lesion. We did a biopsy, confirmed it. We put a wire, we excised it, and we sent the patient home next day morning. And without any defect, you can see this is a lady, although she's a little elderly, we can remove lesions. The scar is hardly visible, and that is called oncoplastic surgery. As I was talking to Chavi Mittal earlier on this morning, where a surgeon who is doing breast surgery is equipped with the knowledge to do oncological surgery and plastic surgery at the same time. So he requires to have the knowledge of a surgeon, a radiologist, and also a surgical oncologist, so that you can achieve good margins like this. Someone like this who has a tumor in the bra line, we call this the bra line, and if there is a lesion there, if you make an incision there, it's going to cause a huge defect. So we make an incision around the nipple areolar region and we excise that lesion so that the scar is hardly visible, there is no defect in the breast. That is oncoplastic surgery. So in this day and age, if someone is diagnosed with breast cancer, if someone is having a lumpectomy, we need to make sure that there is not only oncological clearance but also excellent aesthetic outcome. So this was published, I was invited to write a chapter on this. So breast conserving surgery cannot be done when the cancer is large. That's actually a myth. Nowadays, in this day and age, even if the cancer is large, for example, this lady has more than 5 centimeter cancer. She was advised to undergo mastectomy. But there is no need in this day and age, not all patients. Of course, some patients do require mastectomy, but you can downsize the tumor, what is called chemotherapy, reduce the size of the lesion, and we can excise the lesion and reshape the breast. And in those where we can't conserve the breast, we can offer reconstruction. This is a lady on the right side. She underwent reconstruction so that you can reshape the breast by bringing tissue from different parts of the body. This is the lady who had to have a mastectomy. And a lot of times people think mastectomy for breast cancers ensures long-term survival. The answer is no. The fact of the matter is, these are two graphs. Women who undergo breast conserving surgery, that is lumpectomy, followed by radiotherapy, versus mastectomy. There is absolutely no difference in survival. So if a doctor tells you, okay, to be on the safe side, let's remove the breast, the answer is wrong. We were discussing again about this with Chavi, and this is a very important fact that you can convey to people, that just because someone has a mastectomy, it doesn't ensure that their survival is better. Yes, there are certain circumstances where we have to do a mastectomy, but that's not the reason why we need to do a mastectomy, and this has been proven through several randomized controlled trials. And the final component of my slide is, because in our country, counseling is not an important component of care, doctors do not wish to spend time on speaking to patients, discussing with patients. We have come out with a mobile app on ABCs of breast health, which is freely available to be downloaded in both App Store and Google Play Store. It has every conceivable information about every possible aspect of breast health, which has been explained in simple, easy to understand format, not just in English, but in 11 languages. And we had the privilege
and Dr. Raghuram, may I just offer my services, my voluntary services to this wonderful campaign. If in the future you would require to
So, in conclusion, I'd like to say that it's important for women of all ages to be breast aware. Any new changes, particularly painless lump in the breast, blood-stained discharge from the nipple, recent excoriation of the skin around the nipple areolar region, recent indrawing of the breast, please don't ignore. It doesn't mean it's a cancer, but it's important to go to the doctor, to get the triple assessment done, not to succumb to have surgery straight away as soon as you visit the doctor, to ensure that a core needle biopsy is done and not fine needle biopsy, and then early detection is the key, because we can't prevent breast cancer. Yes, we can reduce the incidence by following certain lifestyle principles, which we can bring up in discussion, but the early detection, ensuring early detection. How do we ensure early detection? By being breast aware, and for women from the age of 40 to have an annual screening mammogram. Thank you very much, so that we don't see cancers like this, and that is what we are here for. Thank you very much.
This was very insightful. And ladies, I would like to reiterate that on 30th of May this year, we had tied up and distributed Virenchi health cards for all our members, entire member base, wherein a battery of blood tests and ultrasound and mammogram and pap smear, all of it was free of cost for all of you. The package now stands expired, but if somebody still wishes to avail it, please get in touch with Gunjan, send her a message. She will revalidate a card for you and have it sent to you. But this is one thing that we at Flow provided for active health concerns for our members. You can still avail that offer. Thank you so much, Doctor. Chavi, you have been a very recent breast cancer survivor, a warrior, and I have personally seen your journey, how beautifully you fought it. So let's discuss all of that. To both of you, in your journey and sir, in your medical history, first of all, why is it happening that breast cancer is hitting to women at a very early age these days?
That's a good question. So if you see our country, the population statistics, if you see the pyramid, it's at a very broad base, very broad in the middle and narrow at the top. 87% of our population are under the age of 50. So we are a young nation. And that is the reason, because so many people in this country are young, it's just that we are seeing a large number of women who are diagnosed young. I don't think there is anything else to it, because there's no other scientific evidence. Whereas in the West, the vast majority of population are over the age of 50. So it is a totally different population spectrum here, and that's the reason we are seeing breast cancers in the young, which can be aggressive, which can be difficult to manage, and which can be very challenging.
Chavi, why don't you share some insights of your journey as an actor, as a young mother, and then cancer happens?
So I think first of all, what I want to say is, Doctor, the presentation that you gave was very, very insightful. And even though I've experienced everything firsthand, there are a lot of things which I learned. Mammograms, they are only for 40 plus. I wasn't aware of that, and I thought 25-year-old girls should also get a mammogram done, because the cancer is now prevalent in younger age groups as well. But having said that, I think none of us in this room wants to I mean, the thought doesn't even come to our minds that we could get breast cancer or any cancer. It's something which always happens to the other person. So whether you're a mother, whether you're not, whether you're married, unmarried, young, old, if cancer hits, it's always overwhelming for everybody because you're just not expecting it to happen to you. So when it happened with me, I think when you get something like that, at least that's the way I look at it. And thank you so much for telling me that you've been following my whole journey. And a lot of people have reached out to me saying that it was great the way I fought cancer. But the way I look at it, I feel that there's no choice. There are certain things in life where you don't get a choice. When you get cancer, your only choice is to fight it. So the way I see it, I had two choices: whether to fight it negatively, sadly, sulking, or to fight it happily and positively, because however long the journey is going to be, and I'm still like recovering fully from the surgery. It's been 6 months. There are certain side effects which I feel I'm going to have to live with. So it's an ongoing process, but I can either sit and sulk about it every day and feel why me, or I can feel that I want the best quality of life even after cancer. And that's what kept me going. And that's exactly what I've told my kids also, that it's okay. It's just like any disease. You get COVID, you treat yourself, you get okay. You lose your stamina for a while, you take time to recover, you take care of yourself, you learn certain things on the way. So I learned a lot of things as I fought with cancer. And I think it's only made me a better person.
And tell us about your journey after you accepted the fact that, all right, I have to face this dilemma also in life. Then how did you progress? How did you fight it out? What gave you the energy? I mean, I was seeing what gave you the energy to take it all on social media, to be so happy about it. You know, it did. I remember the third day of her surgery, she was going down to get her hair done. And I was like, oh my God, wow.
Okay, so when I came out, when I announced it on social media, I didn't think about it so much. The only thing I thought was that I cannot live a fake life, and I am a social media personality. I share things which happen in my everyday life, what I do with the kids, what are my thoughts on parenting, on different things, which current affairs and things like that. What are my thoughts on C-sections and everything. So if I'm going to continue to talk about my life every day, I cannot hide the fact that I have cancer because I'm going through it. That's going to be like the only part of my life at this point. So I decided to come out with it. I still remember my mother was not very happy about it. She said, you just announced it like that. बता तो देती अब मैं भाभी को क्या बोलूँ I said you should have told them. I told you just tell everybody. But yeah, that's like the initial reaction which most people have. But when I shared the news, I got a tremendous response. I had thousands and thousands of messages coming in every day, and I read stories of different survivors. I read messages from people who were fighting with cancer, different kinds of cancers. I got messages from people who've seen other people fight with cancer. And the only thing which I saw common in all these messages and all these struggles was that there was a hint of sadness in everybody. And everybody was feeling sorry for me, that, oh, we are really sorry that this happened to you. And it's really difficult, and all the best. And I thought that, no, this is not the perspective that I want to fight my cancer with. I want to make it positive, and I'm going to make my journey on my own, and I'm not going to let anybody else's experience or anybody else's journey define my treatment. And hence, I decided that I'm going to share everything the way. So just because somebody has cancer doesn't mean that every day at the top of your head you're just thinking, oh, I have cancer, oh, I have cancer. You don't think like that. You still, go to the kitchen, you maybe make a pancake for yourself and you eat it, and then, you spend time with your kids and you play with them. There are moments like that. So why not document those as well? And then also tell people that this is what I'm going through, and along with it, I'm also doing this. So it's okay. Life can be normal. And that is why I started sharing everything.
And this also gets me to the question, how important is counseling in cancer care, which most cancer patients do not avail?
So I think there are two aspects to it. Counseling is very important. Firstly, you have to make the person understand that this is not the end of life. This is a disease. And right now we are living in times where there's so much that can be done. And as doctor pointed out, mastectomy is also not the only option anymore. You can go in for a reconstruction, conserve the breast, and you can do so much. And the technology is so advanced that even if you have to go through chemo, radiation, and all of that, everything is temporary. The side effects are temporary, and eventually you can survive. So that kind of counseling is important for a patient to understand what their options are, and then decide and make an informed decision about how you want to go about it is very important. But the second aspect of that is that sometimes you end up telling the cancer patient that the worst side of the scenario, and I feel sometimes it can have an adverse effect because you suddenly see and get to know the horror stories, and you feel, oh god, this is what's going to happen to me. So it's very important to give the right kind of counseling to make them understand that this is a scenario, but this may not be your scenario, and there are so many different scenarios which can happen with you. Am I making myself clear? So sometimes it can have a negative effect also. So hence the kind of counseling which is being given is important, and I think doctor will be able to throw more light on that.
I think you've touched upon very important components. So because as I mentioned earlier, counseling is very, very, very crucial. What happens when someone is diagnosed? It's like a veil. Whatever the doctor is telling the patient and their relatives are in a state of shock. They won't be able to understand because cancer doesn't just affect the body. It affects the body, mind and soul. So just treating the body, however good you may be, won't work. So you have to speak, first of all, be available to the patient, talk in the language of the patient, not with complicated medical jargon, to comfort the patient, to answer the patient's questions, not be in a hurry, so that the patient gets that inner strength. Once she gets that inner strength, I can be 100% sure that more than 50% of the battle is won. The rest of the 50% is only treatment. If that initial 50% doesn't take place, I have seen many, many patients, when they're depressed, when they're in a negative state, whatever treatment may be given, it doesn't work. So counseling is an extremely important component of care, and actually explaining the options, drawing diagrams, and explaining the reason why a particular option should be taken, what are the pros, what are the cons, getting them to connect with patients with a similar background, similar stage, similar age, all of this helps.
I would also like to add that when I decided on the surgeon that I wanted to go ahead with, I also consulted another surgeon who outright suggested mastectomy to me, saying that what you said, you don't want to take a chance, and we just want to eliminate all of it, and it's just very easy. Just take it out, and we'll put an implant, and you'll even look the same. It's beautiful and all of that. I was totally sold. I said, yeah, sure. Well, I don't want to take a chance. I'm going to look the same. So what's the difference? And then I met this other surgeon, and I told him, what about mastectomy? He was horrified. He said, what? I said, yeah, just take it out and put an implant, because now I know. I've just spoken to the doctor. And he said, no, Chavi, firstly, for all purposes, you are going to have a dead organ. You're not going to feel anything. You want to live like that. You're just 41. You want to live the rest of your life like that. You don't need to. You have a small lump. I will take it out. I will do a lumpectomy, and I will do a reconstruction. You will still look the same. You will have your sensation, and you'll have the best quality of life. And I think I decided that, yeah, I want to go with him because he's going out of his way to conserve my breast. But had I chosen mastectomy, I know that I wouldn't have been able to so take it so positively, because I wouldn't have been happy with the outcome. And you asked me another question which I didn't answer. What did I decide, and how did I decide to do it and stay positive? So I asked him that right now I'm at point A. This is me with cancer. I want to reach point B, me without cancer. And point B is not just me without cancer, it is a better me without cancer with a better quality of life. How do I reach this point B? So I'm going to take this step, this step, this step, this step, this step, this step. So I took each day at a time. First, we'll do the surgery, then we'll recover from the surgery, then we will do radiation, then we will do this, then we will take care of the diet, then we'll do this. It was just one step at a time, and I did not overwhelm myself with everything together, but I just took one day at a time. And when I remember when I got back home from the surgery, my hand was only lifting this much, and in 2 days my hand was going this much. That was like a huge accomplishment for me. I celebrated it, and slowly when I could take my hand up till this much, I like literally had a drink and I celebrated like, dude, I'm kicking ass right now. So yeah, it's just you take one step at a time and everything can be behind you.
And then I've seen you lift weights also with the same hand.
Oh yeah, I do
Very
pull-ups
soon.
also now. Do you have a bar here?
No, we believe you. So, doctor, what is your opinion on the various herbal and Ayurveda treatment in addition to the standard allopathic treatment when cancer hits?
And that's a tricky question to ask an allopathic doctor, but I'll answer it because I'll just speak from my experience as a treating surgeon. Many times patient comes, their relatives come, and they have got certain faith, they've got certain belief in alternative system. Some of them wish to explore it, some of them have already explored and they have come to the doctor. And so the doctor is faced with a situation to either rubbish it because he believes in allopathic science where there is a plus 1 has to be 2, whereas there is no rationale in many of these Ayurvedic and homeopathic treatments, but it works. It works for simple ailments. Whether it works for cancer or not, I don't know. So I put it to them that I listen to them. I don't rubbish it. That's the first thing I do. Because that's the first thing the patient doesn't want. Suppose the patient is told, what nonsense are you taking? This is going to ruin you and this is not going to help you in any way. The patient is put off. I don't do that. I say, okay, I express interest in what they're taking. I even ask what medication they're taking just to ensure that we are on the same page. Once I take the patient's confidence, she knows that, okay, this doctor has expressed interest, I slowly bring in the issue about why we are doing what we are doing in allopathy. And I would also tell the patient that I have no problem if you use allopathy or homeopathy as long as that medication doesn't contain estrogen and progesterone, which can aggravate cancer. Sometimes we don't know what these medications are there in those allopathic Ayurvedic treatments. So then they go back to their doctor, they ask what is there, and then they take. So I think it is not, as a doctor, we shouldn't play God. We shouldn't say, okay, you have 5 years, you have 2 years, you have few weeks. It may be bad cancer. You can say you need not be, you need not give false assurance. But there is a way to put it across to the patient and give that patient that hope to cling on to. Let her take that allopathic medicine, provided she is taking let her take the Ayurvedic treatment, provided she is also sticking to the allopathic treatment. So that's how I would.
Also, I think so. It's a little bit like when you put on a lot of weight and you want to lose weight, you have to take extreme measures. You can't just go for a walk for like 10 minutes a day and expect results unless you do it constantly for years and make sure that you don't put on more weight during that time. So it's like that. Ayurvedic or homeopathic treatment is like that. It's slow. But do you want your cancer treatment to be that slow? Because cancer is progressing. It could be an aggressive cancer. Hence, along with allopathic treatment, you can try Ayurvedic and homeopathy as well. I believe that why does one person with the same lifestyle get cancer and the other person with the same circumstances, age group, lifestyle doesn't get cancer? So there is something which we don't know, and medical science also doesn't have an explanation to that. Why does a smoker doesn't get lung cancer and a person who's never touched a cigarette gets lung cancer? What is it? So maybe there are certain things in the body which medical science is not able to explain, and it needs some kind of a deep-rooted cleansing or something like that. So for that, I believe in Ayurveda and homeopathy. But for diseases which are so extreme, I think allopathic treatment is the best option, accompanied with Ayurveda and homeopathy for a long-term solution.
Very, very recently, just a few weeks back, I read in the media there was a report on some drug being developed in the Western countries, which is a single shot administration that cures cancer. So, what's your take on that? Is that a new advancement in the medical science?
So there are many trials that are happening across the world, including finding a blood test to detect breast cancer. So all of them are in the trials phases, and there is no single magic bullet. Cancer treatment is always multimodality, decided by a multidisciplinary team. As I mentioned to you, the team comprising of a surgeon, the radiologist, the pathologist, medical oncologist, radiation oncologist, and multimodality treatment, surgery, chemotherapy, hormone therapy, targeted therapy. So various treatments, not all are required for every patient. It is tailor-made, it's all personalized medicine nowadays. So each patient requires a certain protocol, which is decided by the team. So no single treatment or no single drug will cure cancer as of now.
Thank you. One of our members has asked a question. Should any women have the fear of breast cancer if she's had history of uterine or ovarian cancer? If yes, what is the probability of getting affected with breast cancer and what are the best precautions to avoid the disease?
Okay. Uterine cancer and breast cancer have no relationship. We have a gynecologist here as well, eminent gynecologist, Dr. Manjula, welcome. So basically ovarian cancer and breast cancer are related, and as I mentioned to you in the slide PowerPoint presentation, out of 100 people, 5 to 10% carry this familial risk. Not everybody. As I said to you, if someone's mother is diagnosed at the age of 55, it doesn't mean they're at an increased risk. I mentioned to you certain things. When breast cancer occurs in very young, under 40, or there is breast cancer and ovarian cancer in the immediate family, or more than one breast cancer in the immediate family, or male breast cancer, that's when the risk of abnormality, that is mutation within the BRCA1 and BRCA2 genes is possible. And in those women, whereas the general incidence of breast cancer, as I have mentioned again, is about 13%, 10 to 15%, with this BRCA mutation, it goes up to 50 to 70%, breast cancer. Ovarian cancer, again, about the risk in the general population is about 1 to 1.5%, whereas when someone has BRCA1 mutation particularly, it's from 40 to 50% is the risk. And that's the reason after genetic counseling, they get the genetic test and whatever treatment is recommended. So that is what can we do to prevent is what you said. So I think as a general rule, can we prevent cancer? We can't prevent. But cancer also has become a lifestyle disease like many other diseases, particularly breast cancer. Any factor that increases the exposure, uninterrupted exposure of the hormone estrogen on the breast can potentially cause breast cancer. Like early menarche, late menopause, you can't do anything about it. But there are certain lifestyle modifications like late marriages, not having children, having the first child after 30, not breastfeeding, sedentary lifestyle, not exercising, obesity, all these are modifiable factors. And if we can take care, and that's the reason why breast cancers at one point of time, now it's almost the same, the incidence of breast cancer is lower in rural areas because they get married early, they breastfeed for a long time, they have multiple pregnancies. So there is an interruption of the hormone estrogen. That prolonged uninterrupted exposure is broken. That's when the incidence comes down. But as a general rule, eating a healthy diet, I'm sure Chavi will be.
I was actually just thinking you were counting all this huge list of factors. It's a cross for me on every single one of them. I still got cancer.
Yes.
So like there's literally
It's sporadic. That
yes.
is sporadic. So it's not. So as this proves that you cannot prevent it, you can reduce the chance of getting the disease.
I think early detection is what
Early
is the
detection
most
is
important.
the only way we can really make any impact in terms of ensuring.
So I want to know this room full of women, how many of you do a self-examination of the breast on a regular basis? That's amazing. How many of you go to the parlor to thread your eyebrows? So see, it's important. Just do it. That's the first step.
But can I just interrupt and I don't know, I'm not sure. Can I just highlight about the importance of breast awareness versus self-examination? Because this is the biggest myth even amongst the medical fraternity. The concept of breast self-examination is that the women are encouraged to look, feel the breast at a particular time during the month. Yes? That is self-examination. Now, this is a concept that has been given up. You won't like me if I say this. It's a concept which is given up. The concept now is called breast awareness, where women of all ages, are encouraged to look and feel throughout the month. There is no set pattern. As I mentioned to you, painless lump in the breast, blood-stained discharge from the nipple, excoriation of the skin around the nipple areolar region, dimpling of the skin overlying the breast. These are changes that one has to look for. The breast change throughout the month. There is no set way of examining oneself, whether it's through when having a shower, applying a cream. On a daily basis, it is important for women to know how their breasts look and feel. That is the concept now. The reason why I'm saying this is not because I'm saying it. It has been proven through several randomized controlled trials. The largest trial, you can look it up, is the Shanghai trial, where they followed up two group of women. One group who were taught self-examination, another group who were taught about the importance of breast awareness. They were followed up for 5 years, and they found that in the group who were taught self-examination, they became paranoid, and they would have unnecessary biopsies done. Whereas women who were aware, they knew how her breast will look at a particular time this month, how it will look at the same time next month. And the incidence of breast biopsies, operations, everything came down, and the survival was no different in those who were diagnosed with breast cancer. So the concept now is to look and feel on a regular basis, report any changes to the doctor without delay, and from the age of 40 to have an annual mammogram without fail.
And you know where you're getting your free mammograms. You can always contact us. With this, I open the floor to the audience for any Q&A, though I've taken some questions, but any other question? All right, I think you've answered a lot, doctor. So could we have a parting note from both Chavi and the doctor?
Okay. First of all, I'd like to thank Flo again, once again. I'd like to specifically thank Gunjan. You know, she's so meticulous. Her attention to detail, I think she speaks for the entire executive committee of Flo. She's so meticulous, attention to detail. It's really amazing. And that's why you're running an organization like this faultlessly for several years with several distinguished people as past presidents as well. So regarding breast cancer, as I said, you know, out of difficulties grow miracles. And Chavi is an example. I think she's an epitome of indomitable spirit in the fight against cancer. So when someone is affected with cancer, with the inner strength to fight, 50% of the battle is won. That's as far as survivorship and conqueror. You're a conqueror as far as I'm concerned. We don't use the word survivor. We use the word breast cancer conqueror from our point of view. And to the people here, you're in a position to empower your friends, your family, your mothers, your sisters, your grandmothers. I think we've just passed the festive season. During the festive season, we unfortunately don't have men. I'm the only one. It's the duty of the man to look after the woman in the house. The woman is the nerve center for the family. If she is well, all of us will be well. If she is not well, none of us men will be well. So I think it's our duty to gift a mammogram rather than gifting a sari, or in addition to gifting a sari or a necklace. I think it is so important that we are fortunate that we can all afford a mammogram. Every year, October is the Breast Cancer Awareness Month. Whether it's in October, November, December, whichever month you want. But every year, please ensure you and your loved ones get a mammogram done. And I'm sure that will go a long way in saving many lives. And that's the message.
That's a beautiful
Thank
message.
you, Dr. P. Raghuram and Ms. Chavi Mittal for such an eloquent.
Yeah, I just wanted to say that I was very lucky that my cancer was diagnosed early just by fluke. But not everybody is as lucky as me. And for that reason, it's very important for breast awareness, you said, right? So it's very important for all of us to know how our breasts look and feel. And if you can't do the job, tell your husbands; they'll do it for you. But yeah, it's really important for us to know our breasts so that we can take care of them. And I think, for me at least, the way I look at it, when you get something like cancer, uh, you just leave everything in your doctor's hands. And it's the easiest thing to do, because the difficulty is when you have to make the tough choice. Here, the doctor is making the tough choice for you. Don't listen to anybody else. Don't Google things. Please don't Google things about cancer. Just listen to the doctor who you have chosen for yourself, and let him decide the course of your treatment. You just happily follow what he says, and you will be absolutely fine if something happens. That's all.
Well, thank you. Thanks. A big round of applause. I would now request Neetu Baga to get the autograph sheet signed by both the speakers, please.
Do you have a question?
Yeah,
She has
okay.
a question.
Any question? Yeah. A mic?
So we always keep hearing about mammogram. Is there something known as MRI mammogram?
Yes.
So, wanted to know a little more about it. And when should that be done? Like if mammogram is yearly, then MRI mammogram in how many days span? And why is it necessary to go for MRI mammogram?
Okay. Yes, it's a good question. MRI is different from a mammogram. Mammogram, as you have seen, is an X-ray of the breast. MRI is an MRI, which is a non-invasive investigation. So there's no radiation at all involved, but there's a lot of noise there. You have to be in that machine for about 45 minutes. So not all women who present require MRI. In fact, majority of them don't require MRI. When we would do an MRI is, for example, I'm just giving you a scenario. Someone presents with a lump in the armpit where the lymph node is abnormal and there is cancer in that lymph node, because the first port of call for a breast cancer is to go to the lymph node in the armpit, in the axilla. So sometimes when we do the mammogram and the ultrasound, we can't find any abnormality in the breast. We call it an occult cancer, technically. So in such a situation, when there is nothing in the breast, nothing, but there is an abnormal node, we have done a biopsy of that node, which confirms it to be cancer. To look for any evidence of cancer which cannot be picked up on a traditional mammogram, we do an MRI. We also do an MRI in someone who is at a very high risk of getting breast cancer, which I just mentioned to you, BRCA1, BRCA2 abnormalities. So when someone has that abnormality, when someone chooses not to have the prophylactic mastectomy like Angelina Jolie had, when they want to get their breasts followed up regularly, we need to watch like a hawk. And how do you do that? We alternate the mammogram with an MRI. Say if we do a mammogram in the month of November, we would do an MRI in the month of May, and then again do a mammogram in the month of November, so that we don't expose the person to increased radiation. So if we do every 6 monthly mammogram, it will cause more radiation over a prolonged period of time. So we do an MRI alternating with a mammogram in those who are at a high risk. The other reason why we might want to do an MRI is when someone has breast implants. Mammogram is not accurate at picking up lesions because the breast is occupied by the implant. So we require something much better than that. So an MRI is useful in those circumstances. So there are very few circumstances where we use it. So just because we have an MRI, we don't subject patients to getting an MRI. And also sometimes when we have a type of cancer called lobular cancer, when there is already more than one focus and you are attempting to do breast conserving surgery, we want to make sure that there is no other focus of cancer either in that breast or in the other breast. So in those circumstances, to plan the operation, to plan the surgery, we sometimes get an MRI. PET scan is nothing to do with the basic diagnosis. So the diagnosis is obtained through triple assessment, that is examination, mammogram, ultrasound, and a core needle biopsy. That is diagnosis. MRI also comes under the diagnosis. PET scan is a staging test. So once the diagnosis of cancer is made, to know whether the cancer has spread anywhere, particularly we look for the liver, lungs, skeletal system, and the brain. So cancer, breast cancer can go to any of these places. To know whether or not this cancer is gone and to stage the disease, to plan the treatment, we do the PET scan. And PET scan should not be done willy-nilly every now and then. You might be seeing, we do get patients with reports of PET scan done every 6 months. One PET scan is equivalent to 1,000 X-rays. So it is something that has to be done the first time round, unless the patient has a recurrent cancer where we monitoring the disease elsewhere in the body. Otherwise, we don't need to do for early operable cancers PET scans every year.
Thank you, Doctor. I would request somebody from the events team to just come and escort the doctors to their car, please. Thank you very much. A, a very warm welcome to Dr. Manjula Anagani Padma Shri, requesting her to join our chairperson, Ms. Shubha Maheshwari, on the dais. I now request Chairperson Ms. Shubha Maheshwari to felicitate the Honorable Speaker, Dr. Manjula Anagani Padma Shri, with a flow memento. Requesting Ms. Pooja Mitra to introduce our guest speaker, Dr. Manjula Anagani. Ms. Pooja Mitra to introduce our
Take great pride in introducing Dr. Manjula Anagani, a Padma Shri awardee, a Guinness record holder. She was bestowed with the Indian of the Year award at the India Leadership Conclave and with the Legend Award by Times Healthcare Achievers. Dr. Manjula Anagani is also the founder secretary, IAGE Telangana chapter. Apart from being recognized for her service, Dr. Anagani has also been widely acknowledged for her noteworthy publications and research work in the field of medicines. She conducts regular training for laparoscopic techniques across the country. A pioneer in laparoscopic and minimally invasive surgery, Dr. Anagani has successfully performed over 20,000 surgeries in gynecology. She is a visiting laparoscopic surgeon in NMC Specialty Hospitals, Dubai, and is an invited operating faculty for many national and international workshops, CMEs, and conferences. A very warm welcome to you, Dr. Manjula. We all look forward to hearing you today. Thank you.
Thank you so much, Dr. Manjula.
Thank you. It's indeed a pleasure and honor to be among the distinguished august audience here. Most of them are my friends here, so I'll feel more at home, I feel. Slides, can I change the slides?
Yeah, that's
Can
the
we
slide
have?
change.
This is slide changer?
Slide change.
So this is what I thought we will do. Can we have some magic around here to make ourselves magic? Because I'm sure every girl here is a magical person trying to come out with some solutions where we multitask in our house, trying to do that, this, and we come out winners always. So that's what I'm here for. And as always, everybody tells us that it is not so easy to be a woman. But I feel, for me, I love being a woman because we are all beautiful inside out. We are pretty. And we just heard Dr. Raghuram and Chavi say about the breast cancer and conquering it. We are very lucky because of the cancers of our body as a woman are all curable. Almost all except ovary. Rest all the cancer which belong to our organs, that is the uterus and ovary, are all curable, first thing. Second, we do not get heart attacks at 30, 40. We only give heart attacks. That is what we are here for. Okay, you can have a 20-year-old who can be having a heart attack, but we will never have. And we will fall down, but we will get up, but we will not break our bones till we are menopausal. That they just slip and they broke the bones. Looking at one girl that side, one girl this side, they trip and fall and they'll have all the aches and broads, but we are not. So let me see at the end of it, how many of us will agree to that we are lucky to be women. So as we reach the stars, which we are seeing now, I think now we should not be talking about the stars. We should be talking about living in the Mars, living in something more which is going to come. For me, Tom Cruise is my favorite actor. Even now, I know we all have become old, but we still go gaga over the rogue nations and everything because we want to go rogue over him. So when he say that, when he comes up with sci-fi, I am like, when is it going to be a reality? Because we all want to run away to that, but sometimes our body will come in the way. So that's what I'm here for. Is this actually working? Technology is something which always works. So we'll go back, and then that's what I want to know the difference. And so many of the facts we all know, we all talk in hush hush. If you ask a 10-year-old, 11-year-old girl in today's generation, they know more about what we actually talk out about. When we talk, we are like, okay, this is a taboo. We cannot talk about it. And the daughter tells us more things because she heard from her friend or whatever they have heard. So let us actually know the fact. This is only theoretical factor which I put so that we understand that what is the purpose of uterus. So many times we all talk heavy duty things like my purpose of life is to serve the thing. Any Miss India coming up, this is the month of November where we have Aishwarya Rai and Susmita Sen birthday. So we only talk about we want world peace. We want to achieve this. We want to be everything else, but afterwards they'll be in the movies only finally. But still, this is what we want to achieve. So, but what is our purpose of life as a woman? Is the purpose of uterus is only to procreate, nothing else. Work of uterus is only you get periods if you are not pregnant. That's the only thing which is the truth of uterus. We are not talking about ovaries here and the hormones, which are very essential. So, if we have to tell it's only the period. Why periods? Why do we need it? Did we ask for it? Did the God could have just said that, okay, text WhatsApp is the thing. So tell it, you are not pregnant this month, it's okay, you go ahead for the next cycle. But no, we have to get a period that gives us the mental satisfaction. Okay, I'm not pregnant. This is the major thing which happens in life. So many times people are so obsessed about periods, they come and ask me, and then I ask her, did you ever think your grandmother had regular periods? How many of you will say that there are periods for your grandmothers or even great grandmothers? They hardly had periods. Yeah, they had 10 children, 14 children. They were pregnant, pregnant, delivery. When did they have time to have periods regularly? Why are we making it a norm? And we are obsessed over it. Doctor, we are not getting periods regularly. There should be something wrong. I put on weight. It must be because of did not get period. I am having this because of this. Everything they decide, they come up with solution, then they ask us what it. I said, you have decided, then don't ask me. If you want to know, that's what we are here for. Google is, like Chavi said, don't Google. Why are we saying that? If you want a problem, go to Google. Google will definitely give you problems. You want a solution, come to us. That is what we are here for. So, next, like I said, regular menstruation, is it a norm? What is normal? What is abnormal? Nothing is normal. I think you have once in 45 days is still a normal. Once in 21 days is still a normal. You bleed for 1 day is a normal. You bleed for 7 days is a normal. See, you have 5 fingers in your body which are not the same. Why are we again obsessed about it? Don't. And most of the time, the stress which we all go through, courtesy our husbands or children or whatever is happening, is enough to have an irregular cycle of that. But if it keeps repeating, when should you meet us? If it keeps repeating 2 times, 3 times, and if it is more than what your body can take. So when I say what is more than your body can take, menstrual blood do not clot. This is a statement you remember. If you have a blood which is clotting, means this is abnormal for your body. Just meet a doctor. Till that time, you don't have to be worried. Next. Nowadays, we see again, every kid, we never heard of PCOS. My thing with pregnancy is the mother-in-law will come and say, we were very good. We used to go around, do everything. Nowadays, my daughter-in-law तो ये काम नहीं कर रही, वो नहीं कर रही, ये उठा रही नहीं, सब bed rest बोलते ये नहीं करते. और हमारे ज़माने में तो injections नहीं थे, इतना दवाइयाँ नहीं थे, अभी तो everything is very costly and all injections are doctors are writing. Yeah, that is because there are so many things which is happening in today's time, courtesy, our lifestyle changes, courtesy, our environmental hazards, courtesy, again, we are being so protective of our kids. Again, courtesy, what's happening in this situation all around, that we do not do any exercise. In my times, at least the aunties who remember me, always said this girl never used to be on the road. She used to be on the trees and she used to be on one house to the other house on the roofs. We were like that till our inter also. I mean, we never even bothered whether we are a girl or a boy and how we were doing it. That was enough physical activity. Now we cannot send a 3-year-old onto the road to play because of we know what all can happen to anything. We are being so protective that we are not allowing them to have any exercise or thing and the junk food which comes because we are all very busy. Swiggy hai. I hardly think of anybody who are actually making food at home. I don't make. I hate cooking, but definitely not Swiggy. But still, that is what is happening. Why is this which is increasing? It is again because there is something called endocrine disrupting chemicals. This is a big word. It is simply called EDCs. What is endocrine disrupting chemical? The endocrine system in our body, which is like, you're diabetic, that has increased a lot. Thyroid has increased a lot. Why did all this happen? These chemicals are creating this havoc inside the body. How are they being produced? Again, by us. First and foremost, worldwide everybody is talking about plastics, plastics, plastics. Why? Plastics are the main reason why EDCs are secreted. Now, when we say that, it is a dioxins in our diet also, like some sort of fish, some sort of poultry, they all can cause. But this point here I want to tell you is, when we talk about plastics everywhere, it is not what is seen in the road we are worried about. We are more worried about something of a plastic which is nearer to our body. What do you think it is? Plastics in the sanitary napkins. We are keeping some plastic in the sanitary napkin which is close to our genital organs for about 5 days, changing it 3 times a day or 4 times a day, depending on it, which is secreting dioxins, which is creating endometrial cancers, endometriosis, PCOS. So what is it we can do? One what way we can change at least our kids from not getting it? Change over to organic sanitary napkins, which has bamboo sheet or bleached cotton which is utilized for it, or change over to menstrual cup. This is the thing I want to tell you all. Please immediately shift. We are not talking about some plastic thing which is there where Maggie will be there in it or some plastic cover. That does less harm than the sanitary napkin plastic inside that. That immediately decreases all these things. And next point I want to tell about balance versus imbalance. People always come to me and say, oh, we never had to go to any doctor, till now, till 45 years. From the delivery, we didn't have to go to gynecologist. First thing, not going to a gynecologist is definitely not a great thing to happen, because we are talking about preventive gynecology. We are not talking about reactive gynecology. Medicine is about 3 times. One is a reactive, means after you get a disease, you react to it and then again cry or do, brood, go into panic mode. Going to preventive gynecology. Next is proactive gynecology. Preventive is we do these mammograms, what Dr. Raghuram and Chavi has spoken about, is all to prevent so that we can prevent. Proactive is taking multivitamins and also which can be antioxidants to be actively inhibiting the drug from a disease from getting to. So we should be talking about proactive and we should be talking about preventive things. So if you have an imbalance or anything, balance is the norm. Imbalance is definitely not a norm. And if you take in a woman, the 2 hormones of a woman are estrogen, progesterone. That much everybody here knows, including the kids. Now, if somebody has a imbalance, more estrogen and less progesterone, is that correct? Living with it, it's okay. I don't want to take hormones and you don't have a balance back. Is that correct? I want to know this answer from all of you. Do you think balance is a norm or imbalance is a norm? Yeah. So if it is a balance, you are having a high estrogen in your body. We also know that endometrial cancers are because of high estrogen in the body. So having a high estrogen, how do we decrease your estrogen? Either decrease the production of estrogen which is happening in your body or give the opposite hormone so that they both balance. Yes? We cannot decrease what is being produced in the body because it is getting produced. So what do? We give the opposite hormone for particular time, 4 to 6 months, so that we teach the other one. It's like danda leke usko marna ki ye nahi rehna, tum udhar hi raho, utna hi raho. So it might be 4 to 6 months. But getting this paranoia that hormones are dangerous, hormones should not be taken, is something you all have to forget about it. Because the balance is what we look at. But saying that, we should not play with hormones because it's a very good servant but very bad master. It will sit on our head. We have to tell the hormone it has to be taken like this in this particular time for so many days and stick to that. That is something people have to understand. Like I said, like finally when I say lifestyle management, oh, it's so easy for all of us. Like I said, no, you should have lifestyle management, you should do exercise. But physically, actually, how many of us are actually having the time to do that is something important. Because with the children coming back at 3:30, unka padai, khane ka, evening ka, by the time we go, it's all thing. But what I tell people is that physical activity does not mean you need to go to gym or fitness or anything. What is important is every muscle in your body should contract. How is it possible? One is brisk walking, so whenever you're doing, we can do that. But the best thing which all of us enjoy in doing, like ABCD, anybody can dance. Go into the room if you don't want people to see you dance. Close the room. Teen tapori songs, not the smooth songs. Go हेरितिक रोशन का लियो नहीं तो जैकी श्रॉफ का टेगर श्रॉफ का सुनो कुछ भी. That's it. 3 songs means 15 minutes. Every day, please do it. Trust me, that will make your life much more entertaining. Plus, also your fitness. Plus, also your insulin resistance will come down, which is a pre-diabetic state. So you can push your diabetes for a longer time. Dietary changes anyway, कितना करना उतना करना. चॉकलेट देखना खाना है खाएंगे, थोड़ा थोड़ा करेंगे, moderation में करेंगे. But do this 15 minutes of tapori song. You want to do with your kids, without your kids, with your husband. That's all your choice. So that is something which you have to think. Another thing, I'm not covering so many topics because I thought it becomes beyond the things. So few things which really trouble us is what I am looking at. So premenstrual syndrome. Dr. Raghuram just ran away because he's the only man in midst of so many women and we don't know who is going through premenstrual syndrome and who can really shout at them. The same person who is the best lady when the period comes will be very nice, docile, will be shouting at the husband, shouting at the kids, or shouting at your colleague just before the periods come. We're the same. I'm the same Dr. Manjula then also, but our behavior changes. So definitely, if they want to die, they should be clear, they should be messing with us. So we can have bloating, cramps, mood swings, acne, headache. These are all things. Mood swings are something what other people are going to bear for us, but acne is something definitely we are not interested. And weight gain, definite no. We don't want that. So we should be looking at what it is. Most of it, when it comes to premenstrual syndrome, is again the lifestyle and dietary changes. When they come to us, 99% of the people, we don't give hormones at all. Premenstrual syndrome, the majority of the time, the cause is the lack of B6, vitamin B6, vitamin E, all the essential and minerals and the trace elements and the amino acids which are like. So we just tell them to take Wellwoman, Premens Plus or any capsule every day. It is not overlooking. One thing again, at this point I'll break and then tell you that people have the thing that I will not take medicines. I don't believe in English medicines. So we need to understand the difference between supplements, replacements and medicines. Then you will know what to do. Supplements are something which every tissue in your body needs it. If it is not being produced in the body, but every tissue in your body needs it. So you have to give it for the proper functioning of the body. That is calcium, iron, B complex, vitamin E, C. There is nothing like hypervitaminosis in the regular vitamins except A, D, E, K. Okay, this is vitamin A, D, E, K. In moderation we give. That is only when doctor prescribes. Anything which is more in your body with B complex will go by kidney in the urine. So we should not be worried about taking B complex little more. Nothing is going to happen. We have 2 scavengers in our body. One is liver, one is the kidney. They eliminate any toxins in our body unless you take it to the toxicity levels, which is vitamin D, doctors have to write. E, doctors have to write. Vitamin K, none of us actually write because we don't much need it. Body itself will take care of it. Vitamin A, as a kid only we give when there is an ophthalmic issue. In the way we eat in our milk and everything by our nature, we don't usually have a vitamin A deficiency in our body. So these are the things. Only rarely when, again, like I said, acne is more or water retention is more, accordingly, time specific, we give medicines accordingly. But otherwise, it's only the dietary which is very important in this case. Coming to fertility control, this is my favorite statement. Whenever you go to the kids, people 1 plus 1, 11, 1 plus 1, 2, 1 plus 1 can be anything. But in science, 1 plus 1 is never 2. If condom is not used, it becomes 3. So how are we going to make it fertility care? And we have lots of things about this young generation when they go to abroad to have a thing. In fact, I spoke to my daughter when I was sending her for undergrad. I said, yeah, things happen, shit happens, that momentary thing. Movies time we used to think, one night, it was a rainy night. Next 3 months, she's with a doctor with pregnancy. We don't want that. That moment can come, moment can pass. I'm sorry, I'm not encouraging anything, but we need to be in a defensive thing and we have to be careful about 2 things. One is not getting infections, second is not becoming pregnant. Prevention is definitely better than cure when it comes to pregnancy. So fertility control is very, very essential in today's time and we should talk about it. If we don't talk about it to the generation next, they are going to go and listen from somebody else with not the right information. They have right to information and to the right information, which we have to understand that. And coming to the pill, people are all still stuck in the thing. One thing I don't understand is science has progressed so much. When I say science, according to them, medicine has not progressed. According to people, it is technology has progressed. We have holograms, we have that, we have sci-fi. But you know, my mother told, if I take a OC pill, I'll put on weight. My mother told, if I take a OC pill, I will never become pregnant again. These are still stuck in our mind. What we need to understand is that the present generation of OC pills we have is fourth generation. Means the side effects have come down literally to negligible, and only the positive effects depending on what we need. That is no water retention, definitely no ovulation, so no pregnancy. That is a main priority. There is no weight gain. There are literally no side effects. This is one thing which has become the best part of the thing. In the US, in the present time, with the abortion going kaput, only thing which can save them from this is only these pills, nothing else, because they cannot get an abortion done. There's an anti-abortion laws. Luckily, we are staying in India. We should be thanking our stars that we have still the woman right, not just a human right, about not aborting an abnormal fetus also and ending up with death like happened in UK. So myths. First myth about the OC pill is how hormonal contraception causes weight gain. How many of you still believe in that? The pills will cause weight gain. You always heard from 2-3 generations before. That is what I'm telling you. It's a total myth because right now what we have is a 4th generation pill which will never cause any weight gain. If you're putting on weight, please blame it on your not doing exercises, not eating the right food or not. No, nobody wants to blame that because definitely it's not my fault. First thing my daughter talks to me when I talk to her is before even asking the problem, it's not my fault. I said, I didn't even tell you what I'm going to talk to you about. No, it's not. So first thing is not my fault. Nothing is our fault. It's all something else. So we need to search for a blame, the cause for the blame. That's the first thing. Second, the doses have come down to from 30 to 50. It was in the estrogen before, 30. Now we have 20. So absolutely zero side effects. Then progesterone only pills are also there. When people have a thing of blood clots. There are some people who will have an increased incidence of blood clots. We give only progesterone also. They're equally effective and very effective with zero side effects. Again, COCs will cause infertility. Absolute myth. People who are having irregular periods before starting COCs means oral contraceptive pills, will have irregular periods after stopping it also. This is a very interesting fact I'm telling you. Most of the people have irregular periods. Then they get married. Now they don't want to tell that they were having irregular. So they will say, पहले तो बिल्कुल regular थे, शादी होने के बाद irregular हो गया. पहले तो it is like I used to take. Doctor has given me OC pill. Afterwards it has. We are like we have to take the brunt and say, yeah, थोड़े time होता है, क्या कर सकते? अभी तो हो गया ना, तो अभी तो ये करना पड़ेगा. So that's how we have to cover it. But that is a factor because the marriage is at stake, the social thing is at stake. But that is what it is. Now fear of linkage of cancers. OC pills in the long run, WHO clearly says even after 10 years of thing, in fact, the chance of ovarian cancer and uterine cancer comes down by 50%. Why? We know ovarian cancer, anything. We know cancer is something which is multiplying faster. Here in OC pills, we are stopping the ovary from ovulating. Means we are stopping it from multiplying. So ovarian cancer comes down by 50% if you use OC pills at any time also. Uterine cancer also comes down by 50%. So it's actually more advantageous than the thing. So non-compliance, you're not taking it properly because this is something which I see many people. I was so busy, doctor, so I forgot to take the pill. Oh, next day, in 2 days, I went, suddenly I had to go to Agra or something, so I did not carry my tablets. Arey, those tablets are there over the counter in every nook and corner. You can buy one more pack. क्या चल रहा? उधर जाके चप्पल पहनने से 5-10 times कम में मिलता है OC pills. But no, they'll forget. They mess up with the hormonal thing. Then they'll come up. Next question is frantic call. I think we had this thing. So what to do next? So do we have a plan B? The plan B is something like after that, which we regret. Where is the plan B for this? Do we have a plan B, please? So what we have to do, that's what I say, no, when it is always the technique and technology, they both go hand in hand. We always are so much stuck with paperless nowadays. If something goes wrong with our emails are hacked or anything, we are like gone. Getting it back to the thing is very, very difficult, getting back everything. What is lost is completely lost. Like day before, I was in Bhubaneswar evening, giving a talk, and suddenly somebody forwarded me this talk of Sudha Murthy, which I was watching, and suddenly there's a note which comes there, no SIM. I ignored it, left. And from that time, my phone went out of this thing. There is no SIM. So that SIM got corrupted. Now, I was using the Wi-Fi of the hotel, so fine. Next day morning, I'm out. Nobody could get in touch of me till I come. And yesterday I come to Hyderabad, 10:30 flight lands, going in search of a Airtel thing. Sunday, there is no Airtel thing which is there. So somewhere in Toli Choki, I could find one thing. Go take it and think. They said after 4 hours it will be this thing. So without technology for one full day, we don't know if something happens, we are alive, not, it's become like that, you know. We don't have a plan B now. Olden days, we were never bothered because nobody were in touch with anything and we phones were not the main thing which we had. But still we know everybody was safe. But in today's time, if somebody is not in touch with within 2 hours, nahi utha rahe, kya hua? Kuch to bhi hai kya? I mean, call up, I am not getting in touch with that. So just see how she is doing. But that is very important for us in today's time to be in touch. So they want to have a plan B. So that's what we are thinking about. But what is the problem with plan B for this? So what is it is an emergency situation is we can still stop it for even till 7 days. What we need to understand is first 3 days, it will be high dose pill which we give. People are so scared about one oral contraceptive pill which we are giving. They are ready to take 4 times the tablet which we give in emergency contraceptive pill. Each emergency contraceptive pill is 4 times the regular tablet which we give. Means the side effects are real here. It can actually cause fatal thrombosis. If you see here, it can cause a blood clot and people can die also with an emergency contraceptive pill. So take a regular contraceptive pill is what I'm saying. But definitely if you are married, why are you worried? This is only for people who go, life is more dangerous than taking the pill when they become pregnant. So that is what we look at. And the other thing we can do is copper tea when we put it within 7 days. Now the myth about copper tea would be, people always say, after putting the the copper tea, I started having infection. Copper tea will not create infection. It is the intercourse, it's the husband who creates infection, but copper tea will not allow it to get rid of it because it's a foreign body which is there. It holds on to it. That's what we need to remember. So the needs are different. So when they come and talk to us, we will tell them what is the thing. So now that we dealt with fertility control, now comes a major thing what is happening in today's life, infertility. They're married late, career is important, they're 35, 38. Now we are talking about oocyte freezing, we are talking about embryo freezing. As long as boyfriend or a husband is there, embryo freezing is okay. But otherwise, don't mess up, go for oocyte freezing, that is enough. Later we can think about how to use it with it. So this is the reality, yes, we are having it. The other day I said that the surrogacy rule has come with, always there will be a loophole which comes out with it. And if somebody is not becoming pregnant with 1 year, you can still go for surrogacy. Till now I thought surrogacy rules have become very tightened nowadays. Then we get one loophole for the doctors and the patients to utilize that. So this question everybody, especially husbands ask, kya madam mahina mein ek bar ek anda aata? And our semen analysis is 10 million, 40 million, 50 million, still you say it is less, 10 million it is still less. Poor thing, एक लड़की को पकड़ने के लिए कितने million sperms की ज़रूरत है to become this thing. That is a reality. They have to fight against the stream, against the cervical discharge, going against all odds to reach a ovum. One egg के लिए minimum is 10 million we need. When we were student, it was 80 million which was a norm. By the time I came to house agency, it was 60 million which was a norm. By the time I started doing my PG, it was 40 million is a norm. Abhi to tanga ke we all decided 15 million is also normal enough. तुम लोगों को 15 million रहे तो बस 10 से कम है तो IUI को जाएंगे, 5 से कम हुआ तो IVF को जाएंगे. एक तो भी sperm रखो तो कि we can give you a pregnancy. That is what the state we are in. Let me in. So to put it as subfertility, you have to have a ovulation issue, brain signals from the brain come. Then the egg should be released. Then the tubes, fallopian tubes should be open. Then the cervix, it should not stop the sperm from going up. Then you have other factors, mostly the stress and the dietary thing which we are saying, PCOS and hormonal. The same way with the men, semen count is the only thing which we do. Most of the time, husband doesn't come, mother-in-law will come and say, मेरा बेटा तो ठीक है. हाँ भाई ठीक है, कुछ नहीं बोल रहे. We are talking about the count of the semen. We didn't say is important. We didn't say you are having an ED. We didn't say anything. We just need. Without that, we are not going to treat. नहीं, हमारा बेटा तो ठीक है. बच्ची को देख लो, कुछ तो भी है. 3 महीना हो गया शादी हो गया, अभी तक प्रेग्नेंट नहीं हो. 3 महीना, please, irrespective of everything being normal, it can still take 1 year for her to become pregnant. Important. So same thing applies to the men also. So again, I'm now going into the cervical cancer because breast cancer has been dealt with. This is something, again, people have to remember prevention. We have one vaccine which can prevent cancers of not just cervix, vulva, vagina, anal, head and neck cancers. So many cancers can be prevented by
HPV vaccine, which we should know that it is a prevention. With COVID, everybody knows about prevention. That is, that there are 3 vaccines available. Now we have nanovalent. Please go for nanovalent. Previously, we used to have quadrivalent and bivalent, but nanovalent is where you have thing against 9 valent of HPV. It should be given in the upper arm, and against the HPV virus, it is between 9 to 45. When I say 45, should we stop? No. This is made a rule for countries where government is paying or somebody else is paying. Here we pay. So we can always take at any age. Whenever some policy is made for a government, they always take it tol mol ke bol. It is like government ko dene ke liye, this is this viable project for them to give 145 plus women, and how many cancers are we preventing. On that basis they check. But for us, we are 100%. For our family, we are 100%. So even if you are 50 years, please go. If you have not taken the vaccine, go and take the vaccine. So schedule is, that's right. I just, not yearly ones. It's one time. It is 3 doses, 0 to 6. 3 doses you take it, full stop. It's lifetime immunity. How soon will the protection work? Within a month. And how long will it work? Lifelong. You don't have to worry. 3 doses. Give it to your kids. If you're giving for a 9-year-old to 11-year-old, it's only 2 doses, 0 and 6. Pediatricians have taken up now. So next, I'm happy that after we are fighting for it for 10 years, now pediatricians have taken it. And so 2 doses are enough for the kids. But all the women out there, please take it 3 doses. Side effects, literally 0. In Hyderabad, in our hospital, we did a VAER study. We did not have one patient having any side effect with this. So all this side, yes. Yeah, let me come. That's why I made that last safety thing. The controversy was way back in about 10 years ago in Khammam, there were 4 deaths which were correlated to this. When the actual thing came out, the deaths was one with cobra. It's in the village. It was with snake poisoning. 1 girl had a depression and she went into this thing. 2 more had epilepsy and they went to the hospital and all. Now, the issue was there, the whole controversy was sorted out very fast, but you know, everybody wants the news which is like, bachao, 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 bachao will come out. Solution, 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 nobody will tell it about it. So that is what happened. And if you go back and see, it is a path study where the study was not about the vaccine. The study was, can we give the cold chain maintenance in such a way that a vaccine can be taken over by NGOs to give it in the remote places. The study was about that. But the way it was gone out of proportion was that. So VAERS is about it, and this is what. What the routine investigation, this is about the reproductive age group, is all these things. Means somebody which is less than 48, 50 years, is routinely we do mammogram, pap smear, ultrasound, routine thyroid, blood sugars because it's increasing. As if this was not enough, as if pregnancy was not enough, as if cellulites were not enough, as if stretch marks was not enough, we still have something else in store, that is something called menopause. So we are going to it, because it's a natural, we cannot stop it. We have to go through natural event, it's a time of change. So are we going to tell men or pause, or are we going to say me no pause? We are the ones who have to decide. We have to be saying whether we are going to pause or no. 1/3 of our life we are going to live. Nowadays our life expectancy has increased and the menopausal age group has come down. So till 16 years gone, 16 to 46 is around 30 years is this thing. 46 to at least 86, 30 years we are going to live in that. So are we going to brood for everything, say that menopause aa gaya, abhi kya karna, abhi to bachchon ko dekhna. Kyun dekhna bhai, bachchon ko uno khud dekh lenge, why are we worried? It is a new life, new this thing. It should be the new puberty. That is what I put it in the last, we'll see how it goes. Okay, so 50 plus it is increasing. So we have to proactively manage out. Like I said, no reactive management, including cancers. It is proactive and preventive management, and it is a perfect time to evaluate because this is the time when empty nest happened. Children are gone, they're married. Now you are there with your husband only. That is not for tu my. That is to start up the second honeymoon. So that is what we are going to talk about. So this is the time when we all want to do everything. Now, अब तो time मिला, मैं trekking जाऊंगी. अभी तो time मिला, I want to go to Char Dham. So you decide about what you want to do. Both the things, I'm fine with that. But we have to realize that from inside we are becoming khokla. We might look beautiful like a bamboo tree, but we are not teak wood. We are still bamboo. From inside we are going to be thing. Whatever we do, I love bamboo. They look so beautiful, but this is a fact. Okay. So menopause, 1, 2, 3, 4, 5 of it each woman has to undergo. Nobody can say I'm not menopausal at some age or the other. Usually occurs between 45 to 55. The estrogen is the one which comes down, and 4 in 10 will be bothered by some symptom or the other. Not that everybody. There are some people, lucky people, who will not have any problem. That's fine. The olden days people never said. My grandmother did not have because somebody, I want to answer. No, awareness or not also doesn't matter. They were not active is okay, but that's not the main reason. They were not bothered about staying slim. They were nicely अच्छा खासा खाता पीता खानदान का अच्छे थे. The fat releases estrogen. So even though they were menopausal, the absolute estrogen amount was good enough for them. But now we don't want to put on weight. We don't want to be fat. So grandmothers, now we all, the granddaughter people has to tell us, you are looking like a sister to your daughter. So that is what we are all looking at. Who wants to look like a grandmother? You tell me that. So that is what is the reason, and the symptoms are between 4 to 8 years. Okay. So what is menopause? Like I said, around 12 years before perimenopause happens. So it starts with irregular cycles. So 7 stages. Your skin dries up, your vagina becomes dry, you start, this is the time when all the girls only sit and start telling, उनो क्या कर रही है, हम लोग क्या कर रहे हैं, उनका बच्चा का ऐसा हुआ, इसका divorce हो गया, इसका लफड़ा चल रहा, ये सब चलता, we are sweaty because in spite of that, we are sleepy, bloated, forgetful, finally a psycho, but that's a reality, we can all avoid all these things. So we have reduced fertility, this is the greatest part, we don't have to think about using contraception anymore, that's the best part. Menstrual cycles are going to be irregular, like I said, hormonal imbalance is going to happen. Make it a norm by becoming balanced for a certain period of time rather than struggling and allowing that ye to sabko hota hai, and allowing the hemoglobin to come down to 4 grams, 5 grams. No, please. Hot flushes and night sweats, we'll have some jokes about it later. Sleep disturbances, we hardly sleep. So, इतना गुस्सा आता बाजू कोई तो भी लेके ऐसा सो रहा है and you are not getting sleep. Luckily उसी लिए Netflix and Prime and everything आ गया. But still we get, उसमें भी साइको का मूवीज आ रहे थे और उसको ही देखना पड़ता. Vulvovaginal symptoms, husbands start complaining about it. It is a reality. Wives are like okay with it, but husbands, remember that, they complain about the vulvovaginal symptoms what the woman has because she is telling men, oh, pause. So changes in the sexual function, urinary concerns, recurrent urinary infection, and other cell changes. So night sweats and the hot flushes are not to decrease our bills. Agreed, because of hot flushes, you don't want ACs, your current bill is going to come down, but that is not what we are here for, we are not going to suffer about it. So it is an episodic, it can come every time in 60 minutes and aggravated by hot climate. So that's what should we do? If only they can reduce the fat around this hot flushes, decreases the fat around our cellulite. No, that also does not happen. It only eats away the hot suddenly, that thing. And it's not just the hot flushes. Look at the thing. We feel like killing people who are going to talk to them at that time and start telling, don't do that and all. Okay? So, is it only depressive moments we have around this time? Because मेरा बेटा चला गया, husband तो busy hospital, office में ही रहेगा. शायद उसका अफड़ा सेक्रेटरी के साथ चल रहा. All these things, sitting alone, we start thinking about everything. And are we ready to leave him at this age? What is लोग क्या सोचना सोचेंगे? Or I'm so much used to this lifestyle, should I do something? All these things start coming up, and mood swings, because sometimes we are paranoid about things. And then memory difficulties, which is something which all of us now only know, that nominal aphasia means names to bhul jate kaisa bhi, surat to nahi bhulna, wo to hai. At least concentration difficulties, decrease in sexual interest in 30 to 50% is seen. And but remember, natural menopause does not increase the risk of menopause. That's a fact. It is just that and circumstantial and environmental issue which we are allowing it to inculcate into is we are actually manifesting what the environment is telling us rather than the actual hormonal changes. So menopause clinics are something which is important. So 1 in 8 women definitely undergo depression more than this. So at this time, if somebody starts telling me, "Ye karo, chill mom," it is, why are you shouting at me? This is how definitely I am going to react. So and then comes the urinary things. This is the age when just the way how the hormones changes everywhere here. The same way it becomes atrophic there also. Your vaginal wall becomes thin, your urethral wall becomes thin. So recurrent urinary infection, stress urinary undergo. And nowadays everybody has this hook or crook vaginal delivery hona. And then the after effects of that, if it's a bad vaginal delivery I'm talking about, will be stress urinary incontinence, all this incontinence. But now, This is really thing. So it's all the incontinence and thing. So if we do a proper Kegels exercises, and that is something which is going to prevent us from having so many of the urinary problems which we have. Kegels is very simple. Nobody has to teach you. Sit in front of TV also and just contract the muscles around the pelvic thing. Means by doing a contraction, the muscle around the vaginal area, around the urethral area, around the anus area, everything should contract. Hold for 1, 2, 3, relax. So whenever you're seeing a TV also, you can still do those exercises. But it is 300 times morning, 300 times afternoon, 300 times evening. It looks like 1000 is too much. 300 is 5 minutes morning, 5 minutes afternoon, 5 minutes evening. 5 to 10 minutes every day, if you do 3 times a day, that's a recurrent. Now we have something called Emsella chair, which contracts 55,000 times the muscle. It is about 6 sittings you have, that is 2 times in a week for 3 weeks. If anybody has this laxity of vaginal wall, for vaginal tightening and all, non-invasive, so many techniques are there. You can go for that. This is really not recurrently working. More pain, more gain. This is a reality with menopause. People say, मैं कुछ नहीं करी, हवा कर रही हूँ literally, but still I'm putting on weight. I am not losing weight. Is this a reality or is it a myth? It is definitely a reality. What is happening with decreased estrogen is you have an androgenic thing which is more in our body. So the habitus, where we have the pear-shaped body, now becomes more of man-shaped abdomen and everything. So this we have to understand and work towards it, and we should not just say, it's all because of menopause. We are going to work, and so we have to see that how to control the weight, because it's going to be there. So we cannot avoid it. So how do you prevent it, or rather than take care of it, is what we should look. These are the 3 things which we are always worried about in menopause. Till now everything else can be sorted out, but one thing is, which is a thing where our bones are going to become khokla, our heart disease can still come after thing. Till that time, like I said, we will not get a heart attack, we will not break our bones, but after that, very fast, all these things can happen. Heart disease after menopause, the incidence is same in men and women. And osteoporosis, once within 2-3 years, our bone loss, our brain breaks also same as men and women. So cancers, like I said, breast cancer, we already heard it's the highest thing. Endometrial, postmenopausal bleeding. On this point, I wanted to say that, कुछ नहीं हुआ, थोड़ा ही हुआ, एक खतरा दिखा बस. But even if a drop of blood is seen after menopause, the time when कुछ नहीं दिखना, थोड़ा भी दिखना is abnormal. The time when the bleeding हो रहा है, ज़्यादा भी दिखे तो we are not worried. We try for solutions, because postmenopausal bleeding can cancer can happen even in 5 mm of endometrium. Normal age group, endometrium is a lining which can be 14 mm, 13 mm. Nothing is going to happen. But if it is menopause के बाद, that has to be 4 mm. If it becomes 5 mm, also we see malignancies in that. So that is something we have to understand. That's why we do pap smears and everything. Screening, you heard about breast and all. In postmenopause, one additional thing I want to tell all the women out there is to get your bone mineral density done. Because we can prevent fractures. We can prevent your bone becoming weaker. Get a bone mineral density. If it is in the osteopenia level, start taking calcium, vitamin D and some injections to keep your bone strength, so that we can avoid fractures. Everything we cannot avoid. We cannot avoid cancer. You heard Dr. Raghuram telling cancer we cannot avoid. We can detect early and then do. We can avoid cancer of cervix and few cancers, but definitely regular cancers we cannot avoid. So treatment, last few slides, don't get bored. Okay, lifestyle, it's a fad to say lifestyle management, and then comes prescription, complementary, different thing. So when I say prescription, lifestyle comes to how can only 2 things we can really try to avoid it lifestyle. That is the vasomotor, and that I say hot flushes and osteoporosis. The trick of factor for when somebody is having this hot flushes will be avoid alcohol, caffeine, smoking, hot and spicy food, and hot environment stress. वो तो avoid नहीं कर सकते. Just the hot flushes can give us stress. So good ventilation, minimal heating, light bed linen. That is what is about. Cotton, go back to the cotton things rather than having the silk things. B complex, vitamin E will help. Finally, the HRT. Like I said, this is like for the bones. My doctor told that definitely the bones are going to be lost. Doesn't mean this is the sort of a thing which we are looking at. So you need to avoid smoking, nicotine, and like I said, this is where we end up having the loss of bone. Exercise is the only thing which is pro-bone effect. It is an anabolic effect. Like when I say exercise, everybody has a time now they want to hit the gym and do things. I have seen more people having fractures by tripping in the exercise thing or breaking their bones or even putting those things on their leg and all that and tripping. So this is not we are looking at. So do not take risks and look at safest exercise is walking 3 times a week. If you can do that, that is the best thing what can be happening. So dietary changes, we are looking at multivitamins, trace elements and natural hormones. Finally, one talk about HRT is it's a replacement. Now when I told about supplements. The second I wanted to tell is replacement. What am I talking about replacement? Something which your body has to produce is not producing, we have to replace. It's like salt in a curry. You need salt in the curry. If you cannot eat without salt, it leads you to kidney issues and then water retention and everything. If you take more salt, you will end up with hypertension. So salt to taste. Our body needs adequate thyroid, adequate insulin levels for the sugars and adequate estrogen and progesterone. So we should not get stuck with that taking the hormone. So depending on our body needs, depending on the symptoms, you should discuss with the doctor and doctor will tell you whether it is Tibolone or estrogen progesterone depending on this. So talk to them. Even short duration if you have to take for the urovaginal symptoms, please take it. Don't get stuck. Okay, otherwise we'll end up with this. Either we have to change the husband because husband want to change us. I've had many people postmenopausal coming for a vaginal tightening and the same thing that husband is now having an affair with somebody because she's become old. This is fact which we have to accept and see that we do not end up with this by recurrent what is necessary in that area. Stress, in spite of all this, I still feel gossiping and bitching with girlfriends is the best stress buster. Please continue doing that. That relieves the moment of endorphin release than anything else. And what are the advantages of menopause? We always talk only negative. Is there some advantage? But I'm really forgetting about the advantage because memory is gone. Because menopause fairy has eaten my brain. But this is a fact that we are lucky that our Alzheimer rates are very less and estrogen replacement therapy when we are having menopause will decrease the chance of our memory loss and thing. So what are the other advantages? If you ask a man will say, you are so lucky now, you are also getting more androgens and more beard. So what can we do about the abnormal hair which starts coming? Laser, nothing else what we can do because androgen is being produced because estrogen to combat it is gone. So that is what we need to understand. That is also something which happens because people always come and say, "अभी तो मेरे को abnormal hair आ जा रहा है, इतने साल तक कभी नहीं था, face पे इतना था, मेरा हाथ इतना अच्छा था, मेरा skin never had any blemishes." Now we have all this melasma, everything which is along with that. Finally, we had this very, very famous, but this advantage is no longer there, very judgment in US court where the lady kills the husband, she gets away saying that it is the menopause and the mood swing of menopause. But unfortunately in India, we do not have this, so don't try to do that. I know, we all get tempted, but unfortunately in India, so many rules are not the same as how we have to do the thing about division of property too. So still, I think this is what it is. So about menopause, how do I know nearing menopause? The first sign is almost always the irregular cycles, that is perimenopause. Hot flush, I told you what it is. And are all menopausal women moody? No, because with cultivation we all have managed that. घर पे तो चिल्लाते क्या भी करते, बाहर आने के बाद, yes sir, yes madam, how are you? Yes, how can you talk you bad? All this something which we have cultivated in a thing. So we are going to be etiquette friendly at everything which we do. So does menopause make you forgetful? Actually, some studies say yes, some studies say no, but estrogen loss can still make us forgetful, but we have our own ways of doing it. So what I do, if you see my phone, recently I started writing the name and editing and adding the birthdays there only so that every month when November comes, I open my calendar and say, okay, kiska birthday kab hai? So that I will remember rather than forgetting. So we have to do our own backup thing so that we remember these things. So many women fear the word menopause, but so we should call it puberty number 2 because we are starting a new era of क्या बोलते हैं जाके everything change, learning to know how to take care of ourselves, loving ourselves now for the first time rather than the family. We are not going to put them first. We have to put ourselves first and go for the new honeymoon and everything. So this is what we think. So we can have a menopausal special that is having a vodka, mocha, Xanax, latte and everything, little rest still and go enjoy. But does it mean male do not have? Male do have. That is a reality. But they want to put it, no, मेरे को just GI upset है. मैं इसीलिए मैं चिढ़ रही हूँ because I'm not having some indigestion in the abdomen. But this is a fact which they do have. They have manic euphoria. They do have emotional hypersensitivity, and they do go into emotional depression. This is my favorite actually. But when I say only men, it is always she has he. Everything else, like woman has men, and mania has man in it. So every problem of ours will start only with men. But we should know how to deal with कैसा लट्टू बनाना, कैसा करना, वो देखना. It's not one size. Remember, discuss the options with your thing, and menopause is the time for new beginnings. So thank you all for having me here. I love you all.
Take a few. You take. Please.
We'll have this for 5-10 minutes. And then I have to rush.
All right. As I look through the questions, very important questions. Could you tell us about some supplements that we must
Yeah.
take after 40?
See, if I say that there is Well Woman which is available, I think that has everything in it. And if less than 40 years, I would prefer people to take Pre-Mens Plus. That is a premenstrual syndrome which has adequate amount what a woman should have premenstrually. And if it's more than 40, Well Woman is more than enough. It has everything.
But a few supplements that we could take and we could note and start having.
Yeah. So one is that multivitamin, that is, and the second thing is calcium. After 40 years, what we need to understand is all of us are so busy saving money. We forget that we need to do something called as bone bank. We should save our calcium in our things so that will be of use so that it won't break our bones. So bone bank means only two things. One is calcium, which is the actual mineral. Vitamin D, which is a vehicle for the mineral to go into the bone. And estrogen, which is the one which makes all these things happen. We are losing out on estrogen, so at least we should have enough of vitamin D and calcium. So supplement which we need is one is that, second is calcium and vitamin D. Iron depending on our diet and depending on how much weight. But in today's time, when most of the women come to us saying that mera hair jad raha hai, or all this, the texture of my skin is gone, when we do ferritin levels, they are very, very low. So then we give iron supplements according to the need of the patient. Then we have selenium, trace elements, copper, but most of them are in Well Woman, so usually it covers it up. Otherwise, these are very important things.
Thank you so much. You've
We'll
covered
just
most of our
quickly
questions.
take
Yes, Manjula. Yeah, calcium, magnesium go hand in hand. So when we give a calcium, we always give calcium which has magnesium in it. But first is magnesium is very essential for tendons and muscles. Vitamin E is also very essential for muscles and tendons. And now calcium causes constipation. Magnesium will help in contracting that also. So magnesium is something which relaxes the muscle and the neuromuscular junction. So we give it when people are having this spasms and all those things and bone pains and all. So we do CalMag and everything, which has calcium plus magnesium. We should never give one alone. We always give combination because they supplement each other. They're these things. Yes, that is what main purpose of magnesium is muscle only.
Yeah,
really helps.
yeah.
I have a question. Abroad, they actually say 50 plus, you should get the shingles vaccine. My question is one, do you have it available here? And second, is it necessary to take it?
See, in India, all of us have been infected in the childhood as with chicken pox and all those things. So we don't give it. So vaccines are different for different colors. We never take yellow fever vaccine too here. When we go to Africa, we are told to take flu vaccine. See, vaccines which are essential. Pneumococcal, yes, which is increasing. And the flu vaccine every year is a must. So let us take what is there around us now, like COVID, like flu vaccine every year is a must, and HPV vaccine and all this. Shingles and all at 18 years of age, for chicken pox, we give for as a child, we get it as a kid. So we don't need it now. All some vaccines when we are given our lifetime.
Yeah, Radhika?
Yes,
Yeah.
Radhika. Yes. Yeah, tell me, Radhika. I can hear you.
I had a question that nowadays we're getting few companies which are claiming that they are very hygienic and free of plastic.
Yeah.
Noah, Leica.
I know,
So what
they are
is your
saying,
take
I
on
said
that?
anything which is free of plastic.
Yeah.
Basic thing is don't have a plastic thing. See, why did they have to do? When the fight against this started about 15 years ago, it took them, see, in the world, everything is with money. Pharmaceuticals have lots of money than anybody. So some people's crying and fighting never comes it unless it becomes a big revolution. Finally, after 10 years, they've had the pinch of it and they're coming and claiming that we have this without the thing. But some difference has started. So anything, I am not against any company or for any company. See that there is no plastic inside the sanitary napkin. That's it.
There's one more question. I just wanted to check regarding supplements, what you
Yes.
said. Can we take them continuously, like
Continuously you
calcium
can
and all?
take. आज का खाना खाए आज ही काम आएगा, शाम को भी फिर भूख लगेगा, कल को भी भूख लगेगा. Your body needs it every day.
Thank you.
Yes, ma'am. Of which injection? Vitamin D depends. See, D, I said there are 4 vitamins we never give over prescribe them. What is A, D, E, K? D is vitamin D. Toxicity is more dangerous. So you do a test before taking anything. If it is in 4 or 5, negligible injection is better. Otherwise, you have to take the supplements for 3 months and stop and repeat it. Anything more than 5, we are good. 100 tak we have a margin. More than 100 is toxicity. 50 ke upar we never give supplement. 30 to 50 we give supplement. Less than 30 definitely, 30 to 50 we try to avoid, again depending on the need and everything. Less than 30 definitely need a supplement. Less than 10 go for injection and then supplement. So depending on your level we give and how much, 6 lakh or 12 lakh unit we give it. And then vitamin D minimum is 3 months. Any supplement when we give minimum is 3 months because your body needs that much to there. Now vitamin D, a part about it is always go for a thing which is fat soluble vitamin D. Because this ADEK are fat soluble. That's the reason we cannot give it beyond a thing. Water soluble goes through kidney. Fat soluble, we all of us have fat in our body where it gets deposited and creates problem for us. So that is where we look at it.
Yes, Mahalakshmi?
Yeah,
Yeah.
we have one more question.
Go ahead. Sonia, can you?
Yes. Yes, we have. Yes, we have. There is something called when we give as gabapentin or we have pregabalin. We don't have to give HRT. Like I said, when a lady with menopause comes to us, we ask the symptoms. Are they coming for vulvovaginal reasons? Are we coming for hot flushes? Are we giving for prevention of osteoporosis and everything? A short duration, 2-month course of a gabapentin or a pregabalin, vasomotor symptoms will come down drastically.
And would it, after we stop the medication, would it
It will
continue?
wean off. We don't stop suddenly.
No, would the hot flushes reduce after that?
Definitely they come down. That's why we wean off, make it from 3 times to 2 times after 2 months. Then again wean off so the body gets adapted to it and then stops.
So these hot flushes, there are 2 types. One is that pins and needles sensation and one is just feeling hot.
Yes, hot.
So are they both different or are they
Both
different?
are alag part. It's a spectrum. Like I said, nothing is like, itna hi hota, aise hi hota, percentages. That doesn't work in science. In maths, everything is percentages. But like I said, a simple question about counseling when they had the other day, meeting, we say 99% kuch nahi hota. But finally, if you end up being in that 1%, it is 100% to you. So I think when you go to a doctor, never ask percentages. Because if something goes wrong, I can always be under the chhatri of 1% and say, I get away with a murder also. I can always say that you were in that 1% that did not work with you. What should I do? So it doesn't work with percentages, but definitely, yes. It'll.
Thank you.
We have a question, Monica.
Yes. Yeah, this is a good point, which is very important. Is there are 3 types, in fact, 3 types of the cramps which we have, depending on it, which we talk. Yeah. One is the first day of the period when the pain starts, and by the time the flow starts little more, the pain comes down. What is it? Imagine a balloon with water inside and tie the mouth of the thing, and you are pumping the balloon, hoping that the water comes out. Means uterus is something like that, which has blood inside and a tight cervix. So till the balloon opens up and the water comes out, the pressure builds up inside. That is something called as spasmodic dysmenorrhea. Nothing to be worried, which is not pathological. We just have to take out the thread, right? So we just have to give you some anti-spasmodic so that the cervix relaxes and the bleeding happens, pain comes down. You can take it every month. If you don't take it, balloon does not have ears or opening. Whereas uterus has 2 things called fallopian tube through which the blood can go retrograde and can be deposited inside the abdominal cavity and create the endometriosis or anything like that. So spasmodic dysmenorrhea, you should take a Meftal spas or Buscogast or anything. Now the other one which is pathological is like Hyderabad roads, which is becoming worse than even Bangalore roads, where it's all congestion. This is a disease condition. If you have a fibroid or if you have endometriosis or adenomyosis or infection, these are the 4 conditions where there can be blood which can get congested. The pain starts 2 to 3 days before the menstrual cycle because of congestion and continues till the whole cycle. Means the pain will be for 5 to 7 days. That means we have to evaluate what it is and then treat. So spasmodic, just take medicine. If it is congestive, there is something called membranous, that's a little more pathological.
requesting Miss Sarika to get the autograph sheet, please. Thanks, Doctor, for this superlatives. Okay, one last question. We'll go ahead.
Hi, ma'am. One question with regard to people who have undergone hysterectomy
Yes.
before obtaining menopause. So, is there a need for them to take
Yes.
HRT or any additional supplements than a
Yeah.
woman who has attained menopause?
Now, first thing is that when we do hysterectomy, we don't remove ovaries. Unless ovaries are removed, you won't be menopausal. Removing hysterectomy is not menopause. Removing ovaries is menopause. That's the first myth you all have to forget. Because hormones are coming from ovaries. I started my little chit chat starting said the purpose of uterus is only to procreate, not for anything else. That does not secrete hormones. So as long as ovaries are there till the natural menopause, they will function. Now, if ovaries are removed, they will have drastic hormone deficiency because you're removing it suddenly. Rather than natural menopause, then they need to be given HRT. Now, as far as supplements are concerned, till menopause comes, we give 500 milligrams of calcium. Once the menopause comes, we go up to 1000. The need for the day is for the woman menopausal is 1500. We give 1000 because we get so many people who ask this question of calcium liye to stones aa jayenge. That is a commonest myth which goes on. But one last thing I want to tell before I stop is calcium is nothing but chuna, right? Chuna. So if you take the thing and put it in a glass of water, it dissolves. You put more, it dissolves. You put more, then it starts precipitating. So the fault is not the chunaka. The fault is not the adequate liquid there. If you take adequate water and liquids, calcium will not deposit in the kidneys and you will not have kidney stones. Is the point clear? Yes. Thank you.
Thank you very much for this superlative session.
So there are two, of course, there are loads of takeaways from our session today, Dr. Manjula, but two takeaways on a lighter note is the 5 kgs that I've gained this year is khate pite ghar ka. No, it's good, right? It will help me. Yeah, and secondly, we can't blame Mr. Modi for everything, so we have men in our lives to blame the rest for. Thank you so very much for being here with us.
I'll request Pooja, please, to come near the dais and escort ma'am. A very warm welcome to Dr. Jayashree, requesting her to join Chairperson Ms. Shubhra Maheshwari on the dais, please. Requesting Chairperson Ms. Shubhra Maheshwari to felicitate Dr. Jayashree with flow memento. Requesting Ms. Sindhu to come to the dais and introduce Dr. Jayashree.
Give me a moment. Dr. Manjula has to leave. So, Dr. Manjula, I think on behalf of all of us, we are all floored. I'm just amazed and I'm so happy that I have attended your session. I'm going through all these menopausal changes and I am so grumpy. I get up throughout the night and I'm like, how am I going to give this lecture? I haven't even slept. But thanks to you, I'm all charged. 49, just going through everything, but thanks a lot. Now you can leave.
Is an internationally renowned cosmetic dermatologist with a listers of Bollywood, politics and cricket as her clientele. She is the founder of Skinfinity Aesthetic Skin and Laser Clinics, Mumbai. She is a mentor and the only Indian faculty to speak at the conference of the American Society of Dermatologic Society this year. She is a TEDx speaker and an international faculty for fillers, Botox, acne, scar, and lasers. She is the author of 3 books, the award-winning bestseller Skin Rules and Skin Talks, launched by Shri Amitabh Bachchan. She is the only Indian on the board of directors of the International Society of Dermatologic Surgery. She has been awarded Top 10 Cosmetic Dermatologists as Women Entrepreneurs in India 2022, Best Skin Expert Vogue 2022 and 2016, and many more. We welcome Dr. Jayashree Sharad to FICCI Flow.
Thank you so much, Dr. Jayashree. And a live testimonial of Dr. Jayashree is when I was with her last evening for 15 minutes, and the entire Tollywood calls were coming on her mobile, which I've seen, and I said, I think you just carry on. I'll catch you tomorrow itself. So clearly, you are the woman behind a lot of our celeb skins. Thank you so much for being here. Please enlighten us.
Thank you so much, Shubhra. So I thank the entire team of FICI and all of you for being here this afternoon. And after that power-packed session, I really don't know how boring I'm going to be, but I will make an attempt. Skin, of course, is a very important organ of the body. It's the largest organ of the body, right? And how many of you, this is my book, how many of you believe that skin rules? This book has a lot of rules for your skin, but other than that, do you believe that the skin rules? And I want a show of hands. Okay, almost 80%. Why does the skin rule? Because it protects the underlying structures from the environment, pollution, toxins. It prevents water loss from the body. It regulates temperature. It is a hormonal organ. It synthesizes vitamin D. Okay, and it is a sense organ. So touch, pain, all the stimuli. Okay, so and then if it's too hot, you sweat. If it's too cold, you get goosebumps. That's temperature regulation. So apart from all of that, skin in today's day and age gives you that confidence. If you have skin confidence, that's the best makeup that you can actually carry. And I'm sure all of you will agree with me, right? So yes, our skin rules. Now this is how our skin looks, okay? It is, if you see, this is called the epidermis. Where am I pointing? I have no clue. Okay, so the upper part, can someone help me with the pointer? Okay. When you want to point out, it doesn't. Anyway, so you see the upper layers are called the epidermis, that orangish thing there. That is entirely dead. Okay, that's the stratum corneum. It's the dead skin layer. And below that, you have those, mountain-like things. That entire pink thing is also part of the epidermis. And you have all those living cells there. And below that, this entire thing that you see here is the dermis. Okay, so in the dermis, you have blood vessels, you have sweat glands, you have oil glands, you have the collagen and the elastin fibers, which are making up the basic framework of your skin. So as you age, we all say, oh, collagen degradation, collagen lena chahiye, ye, wo, that is the collagen. And we'll see what happens. So there are two reasons why our skin looks the way it does and ages the way it does. Okay, so one of them is the normal physiological aging process, and that's called the intrinsic aging. It's also hormone dependent, and it's basically the DNA and the gene expressions which cause all this aging. Now, let me ask you, how many of you think, okay, that what is the percentage of genes that contribute to your skin and aging? At 40, you'll say, oh, I have great genes, so I don't need to take care of my skin. So, is it 10 to 20? 20 to 30? Show of hands. How many of you think 10 to 20? Okay, maybe 5 or 7 of you. How many of you think 20 to 30% depends on your genes? 3, 4, 5, 6, 7, 8. Okay. 30 to 40%? 3, 4 people, 5. And more than 40% depends on your genes? Okay, most of you think that. But my dear friends, there is enough research and science which says that it's only 10 to 20% of your skin that depends on your skin aging and the way your skin looks. It's not about features. I'm not saying how are your eyes or lips or nose. I'm not talking about facial features. I'm talking about the aging of skin. Okay? So even if you're blessed with good skin, these are the other factors, the extrinsic factors that are responsible for the remaining 80% of your skin aging, right? Right from diet. So what you put inside is extremely important. UV rays, okay? Then, of course, pollution, smoking,
all the substance abuse, alcohol, stress, huge factor. Okay, sometimes there's no reason for stress, but you're just constantly, overthinking. Why does the maid not come? Why has the cook not come on time? Arey driver abhi tak nahi aaya. Why? Are they going to come if you're going to just sit and worry? So that process of overthinking itself is stress to the body. And then you have inadequate sleep and lack of exercise. So Dr. Manjula has told us that we can all sit and we can all dance in our rooms now. So we'll all start doing that at some tapori dance so that we exercise. And that's very essential. What are the top 4 causes, extrinsic causes? I've told you all of them, but what are the 4 top causes which are responsible? What could be the first one? I'm going to give away my book if you answer me. Okay. Okay. Anyone else? Try a guess. Top. Okay. Anyone else? Somebody said something? No, somebody said something I heard. Who was the first one who said UV? What's your name? You get an award. You get my book. So that is definitely the number 1 reason for extrinsic skin aging, okay? It's ultraviolet rays, and most of us don't realize, and we're never using a sunscreen, right? We wake up at 40, 45, okay? We have to start using a sunscreen right when you're like probably in your early teens, or even children should be using sunscreen, right? The second reason is smoking. The third is nutrition, and then it's stress, and then all the other factors that I told you. Okay, so this is really very important. A lot of us don't realize. So skin aging, if you look at this diagram, again, I don't know if the pointer is going to work. No, it's going somewhere else. I don't know where. But you look at the young skin there, and you look at the old skin, the upper layers become thinner as we age. Okay, that's a part of the intrinsic aging. And also all these external factors which are bombarding the skin. And if you look at the dermis, this is the lower part, you see the collagen fibers here, they've become thinner. And you see the elastin fibers, which are those wavy ones, they've all broken. And that is why you have those fine wrinkles, those fine lines. You have the skin beginning to age. So you have all these signs of aging, right? From pigmentation, melasma, dryness, pores are looking more open. Okay, how many of you think that having pores on the skin is abnormal? Only 2? Everybody thinks, the rest of you think it's absolutely normal to have pores on the skin? No? Yes? So why do you say, I want to close my pores, give me something? Everybody says, doc, come please, my pores are very open. My pores, there are 20,000 pores on the face. They are normal openings of our sebaceous glands. And they're always open. They're meant to be open because that's the normal way for excretion of the excess oil that is being produced by our oil glands, okay? What happens with age? The tube, the opening, which is, actually really nice and taut and firm, becomes lax because of the collagen degradation, and that is why it looks wider. It looks as if it has opened up. So that's one thing. And the other thing is, if you have, because of hormonal changes or PCOS, if you have excessive oil secretion, you feel as if the pore has opened up, okay? All right, so you see wrinkles, you see dryness, uneven skin tone. We all know of all this. So how would you define beautiful skin? What is beautiful skin? What is good skin? I'm very happy that all of you have really, gone on to talk about the right things, because somewhere else I asked and they said, a great jawline and, a great high cheekbones. Please, that is not skin. Okay. So yes, you got it right, all of you. And then skin is not just skincare. It is always, always holistic. So it's diet, it's exercise, it's sleep, it's, learning to deal with stress. All of us have stress here, but learning to cope with that stress, developing a hobby or meditating or doing whatever you want, dancing in the room, whatever you want, right? So that is very important. And of course, you need to avoid smoking. The second major culprit. Okay, it's become a fad amongst young girls, boys of course, but young girls also. They're either smoking or vaping or having Juul and not knowing that all three are equally harmful. Okay, so so it's a holistic thing, and what is really important is to stay happy inside. So if you look at everything positively, have you seen brides always glowing? Because they're happy. So their skin is automatically, naturally glowing, right? They don't need to do much stuff. It's a different thing. They do a lot of stuff these days. But, but no, we are culprits also. But so yeah, so let's come to the most important thing. A lot of you have asked me the AM routine and the PM routine. Should you? How many of you think we need to do the 10 layers of skincare? Or at least 5 layers of skincare are mandatory. How many of you? Raise of hands. Okay. How many of you think just applying one is enough? I am going to do just one thing and that's enough. What is that? 3 things? Okay, okay. Can one of you tell me, okay, I only do one and I think that's really important? Okay, so yes, you got it right. Sunscreen is the most important thing. And if you look at this full thing and that, I've put it very easily for you there. I've written optional. So you do have to cleanse. That's important. Whether you tone or not, I mean, I've never toned my face. If you have very oily skin, then maybe you can use a toner. Otherwise, you really don't need a toner. A serum is optional. So, if you have issues, if you have hyperpigmentation, if you're going to be in the sun a lot, if you're going to be stressed, if you are menopausing, you may need different types of serums. But otherwise, it's very optional. Okay, an eye cream in the morning is optional. A face oil that these days has become a fad, again, is optional. If you have very dry skin, you may use it. But a moisturizer is a must. Especially if you are above the 35 bracket, a moisturizer is a must because the skin lacks hydration. It starts to lose its ability to retain moisture, and the lipid barrier in the skin starts to get compromised. And that's why you have dry skin, you have dull skin, you have flaky skin, you have all sorts of things, rashes, itchy skin, And when the skin has a lot of flakes and the normal dead cells are not, falling apart and new cells are not coming in, when light falls on it, it doesn't get reflected. It gets absorbed and the skin looks really dull. So moisturizing is important. Another reason, I showed you those upper layers of the skin which are completely dead. They do not get the moisture from within. They will draw moisture from the environment. So if you're going to be in the AC all the time, where are they going to get the moisture from? So you need a moisturizer. Apply it on a slightly damp skin so that it traps and locks the moisturizer within. So that is the right way to use a moisturizer. And then, again, heavy oil is optional, but sunscreen, 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 and sunscreen. A lot of you will say, why sunscreen? Where am I getting vitamin D? We will talk about that. But sunscreen is important. And then, of course, don't forget your poor arms and neck and everything. You do everything for your face, and then you sit somewhere and suddenly your arms are showing, they're all wrinkled. Okay? Your feet are scratchy. They're all white because you're scratching. You have to moisturize your entire body. Remember that. At least once a day. Maybe not in the morning. Maybe you're in a hurry in the morning. Maybe at bedtime. But that is very important. And sunscreen over the exposed parts of the body if you're going to be outdoors for long hours and if you're very conscious of the skin getting tanned or hyperpigmented, or if you have hyperpigmentary disorders existing already, then you need a sunscreen on the exposed parts as well. So let's understand the use of the sunscreen. I've put in a few more slides here because we do need to understand that, you have ultraviolet C, which actually does not reach the skin because of the ozone layer, which sort of takes care of it. Then you have ultraviolet B, which is responsible for skin cancer and sunburns. Okay. Then you have ultraviolet A, and if you see it, look at this picture on this on the left, where you see UVB penetrates just the epidermis, causing skin cancer and sunburn. UVA is going right up to the dermis. That's the culprit. Okay, that's the rays. Those are the rays which are causing all the signs of aging: fine lines, hyperpigmentation, blotchy skin, allergies. All of that. And then you have blue light, which everybody has suddenly, come to know of, and everybody's talking about it and saying, oh, blue light from the computer, blue light from the laptop, blue light from... But there's blue light, invisible light as well. There is blue light coming from the sun. Okay, ultraviolet rays do comprise of blue light. And all of that, so UVA and blue light together will cause all these other signs of aging. Okay, so sunscreen should be worn only on sunny days. How many of you think? Very good. I don't need to give a lecture today. Sunscreen is not required indoors. How many of you are applying it, but? Okay, look at that. That's about 20%, okay? Everybody says yes for indoors, but only 20%. Please, the rest of you, start applying sunscreen indoors as well. Applying sunscreen in the day is enough. Why do you say no? Yeah, so with the better, newer sunscreens, you're right. So you need to reapply. If you're outdoors, you reapply the sunscreen every 2 hours. But if you have makeup on, then it's difficult. So then you have to use some makeup which has SPF in it over your sunscreen. And then you get these powders which have SPF, which you can dab, every 2 to 3 hours. And if you don't have makeup, then just reapply the sunscreen. Okay, but if you're indoors, then you're not, and you don't have large windows, then probably you can reapply it maybe once every 4 to 5 hours. Okay. I use a pea-sized amount of sunscreen on my face. What's the right quantity? Anyone who wants my who wants my book? Who said half teaspoon? Stand up. Everybody clap for her. Okay. So yes, that's the right amount. You need absolutely 2 entire fingers, which is equivalent to half a teaspoon. That is the quantity that is needed for proper protection. None of us does that. Nobody does it. People use one pea size or whatever. So obviously you'll get your vitamin D. Itna kam sunscreen lagaoge, so what is the sunscreen going to do? Right? So 2 fingers, that is the quantity of sunscreen. Allow it to settle, dry. It is not going to be cakey, white, greasy and all that, because you have fabulous sunscreens these days. Just allow it for give it 15 minutes to dry up, and then apply your makeup over it. Okay? Okay. So this is why, we're going to use sunscreen when you're indoors, because clear glass allows 75% of UVA to pass through. If you have tinted glass, it's only allowing 25 to 50, but it is still allowing 25 to 50% of sunscreen. If you have low E glass, most of the UVB is blocked, but the UVA is penetrating. So if you're sitting in offices like these, you still need a sunscreen. Okay. What about, oh doctor, but I travel by car only, so I'm not exposed to sun. Of course you are. Okay. You be in a Porsche, but you have a windscreen, which is, in India, you're not allowed these tinted, laminated glass, etc. So you have clear glass, and unless you have a VIP, a red batti on your thing, or some whatever VIP, you have clear glass. So you have 100% UVA, UVB penetrating. And if it is tinted glass, it is still allowing up to 30% of UVA. So unless you're sitting in the center of the car and not really, and nobody does that, you're either sitting on one side. Most of the times you'll see one side of your face is darker than the other. And typically this pigment that comes to all of us, most of us rather, after the age of 40, that's called pigmentary demarcation line. It's darker on one side of the face because you're sitting on that side constantly. So then what about a cloudy day? 80% of UVA will penetrate clouds. Okay? And then of course you have your blue light. So how do you protect yourself from sunlight? Sunscreen. This is the best way of sun protection, but we can't do it. So opt for the, the newer ones which have SPF. PA protection. Now SPF is a measure for ultraviolet B. Indians have more melanin pigment. Melanin is a natural sun protection factor. It's protecting you from sunlight. So if you are a little on the darker side, you're blessed. You're going to age less. Your melanin is going to fight against that UVA. You will not need so much of protection. Okay, so remember that. So everybody who wants to get fair, I keep telling them that, you're blessed. Please accept and embrace your color. Okay, so you need a low SPF. An SPF of 15 to max 30 is more than enough. You don't need 100 SPF and a 50 SPF and, stuff like that. What you need is PA. So look at the sunscreen, look at the label, and it should say PA. A PA triple plus or a PA 4 plus is what is going to give you adequate ultraviolet A protection and blue light protection. For proper blue light, you also need vitamins C and E, and you also need iron oxide. So if you have tinted sunscreens, they're going to be protecting you from iron oxide. And so if you're indoors all the time, opt for tinted sunscreens. So remember that. And then we've talked about how much to apply. We've talked about reapplying every 2 hours, and that's 3 ml is the right amount of sunscreen that you use for the face and neck. And what can I do apart from the sunscreen? Remember, a lot of times people go and say, oh, we went to the beach, we applied lots of sunscreen, but then, we're still tanned. Of course, you're going to be tanned. A, because you haven't applied the right amount of sunscreen. B, because you've not reapplied it. C, because your sunscreen is not going to protect you from every possible visible light and blue light and infrared rays. Okay, we still have to reach there. So you wear caps, you wear your glasses, you use umbrellas, you can wear a hijab. You can, and look at this. This is a real picture. These are twins. Okay, that's the 71-year-old on your right and this one on the left. She was using a sunscreen and the twin sister wasn't. And look at the difference. Okay. And of course, in India, we'll get a lot of hyperpigmentation and melasma and pigment spots as well. So this is a simple, diagram. If you want, you can just click it. It really helps, where it says that whether you are indoors or outdoors, you will still use a sunscreen unless you have it's all dark and you don't have harsh lights indoors, right? Okay, so we finished with the sunscreen dilemmas. Now we will go on to the PM skin routine. Remove your makeup. Cleansing is very, very important. You may not cleanse in the morning. Sometimes people come and say, Doc, I don't like to use a face wash in the morning. Okay, fine. Do not forget to use your face wash at night at least, because you have the oil, you have your dead skin, you have dirt, you have grime, you have everything, the pollution, everything is sitting on your skin. And you need to take that off at least once in a day, right? So it's very important to cleanse. Now, whether you want to use basin or you want to use a face wash, it's all right. Okay, but cleanse your face. That is important. Remove your makeup, cleanse your face. Then the toner, optional. I like to use an under eye serum or, at least a moisturizer, a lightweight moisturizer under the eyes, because the under eye skin is very thin, tends to get very wrinkly, very pigmented. You get dark circles, you get, all sorts of things. Your age starts to show there. So using an under eye serum really helps. And then you use a targeted serum and a targeted cream. Now, what do we mean by targeted serums and creams? Depending on the problems that you have. Like if you have hyperpigmentation, you use vitamin C. If you have dry skin, use hyaluronic acid. If you have hyperpigmentation and dry skin, use niacinamide. If you got aging skin, use retinol. So depending on your skin need, and that your dermatologist will be able to tell you, you will use the targeted serum and the targeted cream. And finally, the moisturizer for your face and neck and the moisturizer for your body. So now comes the skincare. The Instagram and social media is buzzing with all these ingredients, and everybody is like so confused about them. And we don't have youngsters sitting here, but these young girls in their early 20s, late teens, come to me with so many side effects. And when I say, what are you using? Their bag, it opens like one big, some genie's thing, and then comes out niacinamide, then comes out vitamin C and hyaluronic acid and AHA and BHA and retinol. And I'm just sitting and wondering what the hell, because I'm like, am I supposed to be ashamed of myself because I only use a moisturizer and sunscreen? So, well, just because it's all there now, well, we've been prescribing these ingredients forever. Okay, now, for example, retinol. Retinol has been there since 1917. People are talking about it now. We've studied about it in our dermatology. It's just because it's out there and social media influencers and pharmaceuticals and cosmetic companies are now talking about ingredients, suddenly everybody wants to use it. Not if you don't need. Okay? So only if you find the need, what are the important things that you need, I'm going to tell you. But otherwise, you don't need 10 layers and 10 ingredients and, so many things. Eat well, sleep well, stay happy, exercise, dance, and do some amount of moisturizing and sunscreen. Okay, that is very important. Okay, so in your 20s, a sunscreen is a must, a moisturizer is a must. Then you may use a vitamin C and a vitamin E because you're getting exposed to a lot of free radicals. There's a lot of pollution, there's a lot of stress. And so maybe you want to use a C and E depending on your stress levels and your exposure to pollution. Otherwise, you don't need it. In your 30s, sunscreen moisturizer is a must again. And this is the time you want to use an added skin barrier protector like a niacinamide, which also will hydrate your skin and prevent free radicals from damaging the skin, prevent collagen degradation, and prevent add to breakdown of pigment. So it will prevent pigmentation. In your 40s, again, if you see, sunscreen is a must, moisturizer is a must. And then you may want to start using a retinol. I love retinol. And I will use it only once in a week. So you don't need to apply it. There's a way to use retinol. Some people's skin takes it maybe very well. Initially, you may have purging in some people. What is purging? You may have a little breakdown. There may be redness. There may be flaking of skin. So always use less than a pea size of retinol. Avoid all the corners, so avoid using it around the eyes, around the nose, around the mouth. And start with once in a week application, and sometimes you might just do once in a week application is more than enough. And always use a moisturizer. Retinol is not going to make your skin thin. It actually helps in building collagen. A lot of people feel it makes your skin thinner. That's a very big myth. And retinol, if you apply it in the day, it's going to make your own skin very sensitive, is another myth. If you apply retinol in the day, it degrades. So the efficacy reduces, which is why we ask you to use it at bedtime. And because it has that little, drying property, always use it with a moisturizer. And then you have peptides. Now, every possible cream that I look at in the market has peptides. I really wonder if there's enough research that has gone behind it. Okay, because it has to be a very pure form of peptide. I've tried and tested so many which are available, none of them work. There'll be one or two which actually work. So you've got to be very careful about this word peptide and use something which is well researched, probably a better brand. Doesn't have to be expensive. Like I always tell my patients, Pond's cold cream use karo, it's enough. Okay, as a moisturizer. No doc, but no buts and ifs. Okay, use something which is well researched, authentic, and that's more than enough. Then in your 50s is when your skin is really cracking and breaking down. So, especially when you are outdoors, you may want to use a thicker moisturizer, not just on your body, but also your face. So that's when you introduce petrolatum. Okay, then we come to, I'm going to, try and wind up soon because I want a lot of you to ask me questions because, this is all, it should be more interactive. Okay, so now comes, we've talked about skincare, we've talked about holistic care, and then we talk about skin treatments. Are they really necessary? No, they're not. But do you want to do it? Yes. Why? Because then at 49 you look like this. So, so the thing is that the important thing is to understand that there's a very thin line, okay? And you don't cross that line. You don't want to look like somebody else, and you don't want to be overdosing yourself and paise kharch kiye hain to chalo, every line should disappear. No, all your lines should be there, but they should be softer. And why should you do it? Because when you look up, not for your husband or your boyfriend or, your colleagues and your teammates, for yourself, when you wake up in the morning, look at yourself in the mirror, you feel good, you feel confident. And that is why you do basic, little, thode skin treatments. Now, this was a survey done in the United States, of course, which showed that, the highest number of treatments that were done. The number one was Botox, that is neurotoxins. The second was chemical fillers, hyaluronic acid fillers. The third was chemical peels. I'm sorry, the slide is really bad. And then there was laser hair removal. You heard Dr. Manjula tell you about laser. All of us would probably need them at some point. I'm fortunate, I got mine. I tried all the lasers that came to my clinic, back in 2003, 2004. I started practice in 2000. And so now I don't have to face that issue. And then you have other skin tightening treatments and peels and combination treatments, etc. So yes, they are getting more and more popular. When you go to a clinic, or you have these private equity chains these days, and I just sit and wonder, like, what the hell am I doing now? Because then you compete with an Urban Clap who's doing peels, and I don't know if Urban Clap exists here, or with lasers or whatever. But yes, that's the harsh reality. Please be very careful, because if somebody is giving you a list of 10 things to do, you don't need it. You might need those 1 or 2 things. You don't need a skin treatment every month. Unless you have hyperpigmentation and you're trying to do a peel to get rid of that. Or, you have some, like a hair removal. You've got hirsutism and you're trying to do that. You don't need to do a skin treatment every month. Maybe once in 3-4 months. Some little stuff, yes, okay? So that. Now let's look at skin aging. You see how beautifully the skin looks like an inverted, the whole face looks like an inverted triangle. And then as we age, it looks as if everything is just dropping down, right? Looks like a bulldog or like an inverted pyramid. And why does that happen? Not just because our skin and the collagen is breaking down and the elastin fibers are breaking down. It's also because the bone is getting resorbed. It's getting eaten away. If you look at the bone, you look at this eye, the eye socket, and you see how in an older person, the eye socket is enlarged. And that's why we have those sunken eyes as we age. Of course, a lot of youngsters have them genetically, but you'll see it more common with as we're aging. Similarly, you'll see suddenly the upper lip is looking thinner. Oh, I had full lips earlier. What happened? The upper lips are rolling inwards because the entire bone here, the teeth and the bone, are shrinking and going inwards. Similarly, your cheekbones are not so high anymore. They're beginning to look hollow. Your chin starts to regress because the bone here, the mandible starts to regress. It gets resorbed. Okay, so you don't have a proper jawline. What is happening? Look at so that's what is happening. Look at the bone in the 30s and look at it when somebody's in their 50s. And then you have a deep fat layer which starts to get resorbed. There's a superficial layer much later, but there's a deep fat layer also, which also sets, if you look at the picture there, 35 and 55, you see how you're losing fat, right? Because of this, the very foundation is lost. So if you don't have a foundation to support the skin and to support that little fat which is below the skin, it's all going to drop down, right? And that is why you need that sunscreen from the time you are probably 2 years old. That's the reason. And that is why you need a healthy lifestyle. And that is why you need good nutrition. And that is why you need to learn to deal with stress, give others stress, don't take stress, right? So it's very important. And you see how the fat drops and everything looks folded. Your folds become deeper, your sockets become large. And so that is why you need, if we're at a stage where sunscreen was not talked about when we were, at least when I was in school and I was in my college as well, So then you've learned it very late and you started skincare very late and you have, you are exposing yourself to a lot of pollution, this, that, the other. What do? Then you do these treatments. And that is why the need of some little basic fillers or some radiofrequency treatments or high-intensity microfocused ultrasound treatments, etc. So I think I'm not going to discuss fillers. We will, but then this is what you can do with fillers, and you can see the reverse aging, that patient of mine in 2015 and then 2017. You can do very mild amount, very tiny aliquots. You don't have to look like, those apple-faced chipmunks. You just do very little and look natural and subtle. And you can actually make the person look very youthful with treatments done right. And you can see how the eye sockets have been filled with fillers here. And the lips don't always have to look like ducks. That's a misconception, right? You can just about add a little volume to the lip, especially the upper lip. It just enhances your youthfulness again. So it has to be done right. You see the lady up there, you see she's 65, and all we did was just added that little tinge there. And the same we did to this lower one, this young girl here, she's about 30, and the upper lip is what I've injected, not the lower, just to give her that balance. So that is one thing. And then Botox, everybody is scared about Botox, right? Everybody thinks it's a toxin and it freezes your face. Yes, it does freeze. It does freeze your muscle, okay? So when we started studying, our books said Botox paralyzes the muscle. And then gradually we started learning the word, no, it relaxes the muscle. Because the moment you say paralyze, everybody will say, oh, no, we don't want to get paralyzed. But it is given for a whole lot of medical conditions. It was, before it became a cosmetic treatment, it's given for like strabismus, migraines, cerebral palsy in a 10-year-old, cervical dystonias. Now, blepharospasm, okay, where you have, it's a paralysis of the eyelid, wherein Dr. Alan Scott, he was an ophthalmologist, he was giving it, he was the one who invented Botox in the 1970s. And then his student, Dr. Jean Caruthers, she started noticing that all her patients came back with disappearance of the crow's feet. And so she told Dr. Alan Scott that, listen, this is doing something. So he was not bothered. Then she came and told her husband, Dr. Alistair Caruthers. I'm fortunate I've learned from both of them. They're my mentors. She started telling him that, listen, you give all kinds of creams and no creams work, which is the truth. No, once your wrinkles are formed, creams are not going to erase those wrinkles. So then she said, I think I have a formula. And then they studied, and that's how Botox came into practice for cosmetic uses. Okay, so but it has so many other uses when it comes to the injection. It's an injection which relaxes muscle. When you give it in tiny doses, you don't freeze the face, you just relax the muscle. So if you are one of those who has that constant frown and your daughter is saying, why are you frowning all the time? Well, just time to go and get a little bit of Botox because you're happy. You want to look happy. You don't want to look tired. And so you treat all those emotions. Okay. And then when you discontinue these treatments, what happens? Are you going to become worse? No, definitely not. You'll just go back to where you were. Okay. But you're so used to looking youthful that you won't, right? All right. So I think with that, I'm not going through the entire Botox filler thing because then we won't have time for questions. And I told you that you have to have, every time you look at the mirror, you shouldn't think you're going to be a lion, right? Your expectations have to be real and you can't be aping and wanting to look like your favorite actor. Just because your favorite actor, your favorite influencer is talking about falana, this, that cream, it's going to make you look very good. No, it's not. It may give you the worst rash ever because every skin is unique. Every skin is different. Okay. And this whole selfie concept is the worst because it distorts your faces. Okay. So please don't go by it. Okay. And then you have all these plastic surgery apps and simulators. Please don't go by it. Okay, it's always nicer to enhance what you have and be confident in your own skin. So no overdosing and then no looking like this where, this is a very famous, this is one of my favorite emoticons and these are called Botoxicons where you have no expressions left. So please let's not do all of this and yet take care of our skin. And that's my skin talks and my skin rules. And my third one is coming up in March. It's called Skin Care Diaries, and it's very legit questions taken from Instagram. So everybody who's bombarded me with questions on Instagram, I just put them down in that book, and I hope all of you will buy it. And Shubhra asked me if I carried my cards, and I was like, no, I didn't carry any cards.
Do we have questions? Do we have, right here.
Can coconut oil be substituted for a moisturizer?
Yes, it can. Especially if you have very dry skin, it's a very good moisturizer. Be it coconut oil, almond oil, there are studies which talk about it. But if you have acne, then it can really clog your pores and give you acne. So then you don't use it.
Okay, thank you.
Can you just...
So there is a lot of buzz about collagen powders, but there's not enough adequate research, evidence-based data, which says that if you take oral collagen, it's going to make your collagen. We do see improvement in the skin, in the hair texture, but we've not really seen any difference in the skin, and there's no scientific backing for it. So I don't take it personally for that reason. But do I stop people from taking it? No. I've reached a phase in my life after 23 years of practice where I just don't react, and I say, yeah, if it's not doing you harm, please take it. It's okay to take it, absolutely. As long as whatever you're doing is not harming you, it's okay. And some people say, Doc, can I do facials? Yeah, fine. If it's making you feel good, yes. Is it going to make you age less? No.
Yeah, doctor, you haven't spoken anything about hair fall especially.
You know, I can go on the whole day, so with 45 minutes. Yes, hair care is all about, first it's all about diet. Okay, so everything comes back to diet. So we talk of keratin, and keratin is nothing but protein. So you need a high protein diet, you need amino acids, you need vitamins, not just biotin. Biotin is not the only vitamin which is essential for your hair, that's B7, but you need the entire B complex, you need vitamin A, you need vitamin D, very important. You need the minerals and trace elements, so you need, magnesium, zinc, calcium, iron. If you're anemic, you'll lose a lot of hair, okay? And then comes all these different treatments that we end up doing. So, ironing, blow drying, straightening, this, that, the other. Will really, these are all heat treatments which will break our disulfide bonds and make the hair more brittle and more frizzy. So, avoid as much as possible. And if you have to do it, then, use a nice hair oil or a hair serum or a hair heat protectant serum to protect your hair, and then, go on. And don't be very frequent with them. Yeah.
It's mainly the supplements that you've spoken about that really helps.
Yes. And also, I think massaging the oil is an age-old trend. So oil is a great conditioner for your hair, and doing like a nice chumpy maybe once in a week, not overnight. You can just leave the hair oil for about 2-3 hours, and then people ask me which oil, and I say any oil, because you want to condition your hair. So that.
I'll take the liberty for one last question. There is a lot being spoken about the shampoos and conditioners these days, hair care products without parabens, sulfates, silicones, which was not there 5 years back. And we have been using that all our lives with parabens, silicone, sulfates, the products. So suddenly now this newfound discovery. And
so there are lots of these newfound discoveries, and they really don't have enough of basis to them, because parabens are preservatives which are required to prevent contamination and bacterial infections. And maybe there'll be one odd person who would be probably allergic to the paraben. And this whole thing that paraben is causing, breast cancer and this cancer and all is, they studied it in the 2 studies that they found, 2 patients that they found. It was coincidental, just like Dr. Manjula talked about that, the vaccine and, so that, it was similar to that. But, people like to exaggerate things, and there's really not much basis. So if you've used them, yes, if there are sulfates in your shampoo, they can, make your hair a little more dry and frizzy. So sulfate-free sulfates are very good surfactants. They really help to clean. So maybe using a sulfate-based shampoo maybe once in a week, but if you're washing more, then use a sulfate-free. But the rest of them, not true. I will add to it here, and I don't know, people might hate me for saying this, but when you talk of organic and natural, is it really organic and natural? If you're going to put orange in a jar and leave it outside for 4 days, is it not going to rot? Forget 4 days, you leave it, peel it and leave it for about a day, it's going to rot. So you have to add preservatives to it. Once you add preservatives, where is the natural? Unless you're taking something from the kitchen and applying it, don't apply nimbu and tomatoes because Dr. Jayashree has said, oh, it's natural. Because the moment you apply it, it's citric acid, yes, but there's something called the pH and the pKa value on the skin which changes. So the benefit of that citric acid is not being delivered to your skin. and it may actually harm your skin more. There are certain things which I say, bilkul, go and apply. So like turmeric, like aloe vera. Again, there are some people who are allergic to aloe vera, so you need to do a test patch. But otherwise, you can use basin. If you don't have acne-prone skin, you can use turmeric. You can use milk and curd if you don't have acne-prone skin. Because if you have acne-prone skin, that will give you acne again. So there are some things which you can, but you can't just cut every slice of vegetable that's there and put it on your face. Sometimes that can be detrimental.
Any more questions? Yeah, okay.
I just wanted to know which are the face powders, sunscreen powders you have.
So Color Science and Isdin are two brands which are available. I think you'll have to buy them online. Isdin, ISDIN, and Color Science.
Thank you, Dr. Jayashree. I would request Pratiksha to take her book from Dr. Jayashree.
So Dr. Jayashree is giving gifts to our members, the ones who answered correctly. I think it's Pratiksha and Sarita who got it. Preksha and Sarita. And she's also been very gracious to bring it for our past chair council.
And Sarita, the next. Thank you, Dr. Jayashree. May I request Meenakshi Nata to quickly get the autograph sheet done? Requesting Meenakshi to escort doctor to the... A very warm welcome to Dr. Karthik Pingle, requesting him to join us on the dais and requesting Chairperson Ms. Shubhra Maheshwari to join us on the dais. Requesting Vandana Shetty to come here for the introduction, please.
Dr. Karthik Pingle is a renowned orthopedic with over 23 years of experience and a senior consultant orthopedic surgeon with Apollo Hospitals since 2007. He specializes in joint replacement and complex trauma and regularly trains young surgeons. Post completing his MS in orthopedics, Dr. Pingle went on to his MCH in orthopedics in 2002 in UK, where he worked at various hospitals prior to his return in 2007. Dr. Pingle has been conducting several conferences in the last 7 years, and the most recent being the 2020 Orthopedic South Indian Conference, for which he was the organizing secretary. Dr. Pingle is an active member of the Indian Orthopedic Association, Indian Society of Hip and Knee Surgeons, and also Twin Cities Orthopedic Association. Fiki Flow welcomes Dr. Karthik Pingle.
Thank you so much, Dr. Karthik, for being here.
Shubhra, thanks very much for inviting me here. Now, I was here half an hour earlier and I heard Jayashree, and it was quite enlightening to know. I learned so much more about skin, which I never would have. So Shubhra, I first met her in my outpatient some time ago, and then she called me up one day and said, I'd like to invite you here. We've got a lot of queries on bone and joint health. So I don't have a presentation, but I'm very happy to make this very interactive and discuss things which are concerns with some of you or just general orthopedic issues. So let's start with some very basic things. Shubhra, do you want to start or do you want me to start?
You can.
So I've got a questionnaire here with some questions written out. So the first one is, see, basically there are two things that most people ask. About weak bones, osteoporosis, and about general joint pains. I've got some, vague knee pains and muscle pains, and my posture is not so good. So what's the best way to sit? It depends on what your work is, whether you're an IT professional or whether you're a working person. So the first one here is, how do you determine your bone health? And when we don't have a problem, should we go for any preventive screening mode? So generally speaking, people who don't have a problem don't need to see anybody. You don't need to worry about it. As long as you're active, maintain a healthy diet and, watch your weight, what you eat and stuff like that, there's nothing to worry about. There are some who are sports people who do a lot of running, they have some sports injuries, or somebody who says, I go up and down the stairs 20 times and I'm now starting to have knee pain. So when the situation comes when there is a problem, say, as I said, an IT guy is working for 6 to 7 hours a day, sitting in front of the computer, getting up once in 2 or 3 hours, yeah, they're bound to have some lower back issues, neck issues, and that's where ergonomics comes in. What's the best position to sit? Or if it's somebody who's doing a lot of stair climbing or sports and they start to develop in their early 50s or late 40s knee pains, yeah, we should be addressing that. But otherwise, none of you need to worry about whether you should be squatting or whether you should be continuing to play sports. That's not a worry at all. So preventive screening, you don't need to do. Even if you are 50 or 60, you don't need to worry about it. Carry on. When the situation comes, when you're having an issue, that's when it's better if you get it early. You take the info that you get from, say, us or from anybody else or a general physician as to what needs to be done. So on this, let me ask you all, if you've got any questions about this, let's make it interactive.
Yeah, Sujit.
There are a lot of misconceptions about wearing heels. Is it good to wear heels or not good to, or if it is good, how much size? Like what size?
Sure. Okay.
No, because I meet with doctors where they say 2 inches minimum. So
sure.
Just want.
So let me ask you: Do you have any lower limb pain?
Yes, plantar fasciitis have faced that.
Right. So you have plantar fasciitis. Now, plantar fasciitis has got nothing to do with heels. It's basically those people who walk barefoot, sometimes walking very, very quickly across hard marble or tile floor. They develop an inflammation in their heels. This typically gives rise to early morning pain. You get off bed, you put your foot down, you have a sharp pain in the heel, you walk 10 or 15 steps, it eases off. End of the day, you're still struggling a little bit. So that's nothing to do with it. Now, wearing heels, there is no issue if you don't have any knee pain or ankle pain or anything. You can wear, as much as you're capable of being, confident enough. There are people who wear the stilettos, who twist their ankles. That's a different problem. But if you're wearing platform or wedge heels, there is no issue if you don't have any knee pain. If you've got knee pain, or if you've got a bad foot, say you have a flat foot, and then you start having pain while wearing heels for 3 or 4 hours, then you will have to reduce the size to what you think is appropriate for you. There is no definition of whether it's 2 inches is better or 3 inches is better. It's what you can handle.
There is another angle to this question. These days I've been reading, there are theories that say that we shouldn't be wearing flats and the feet should have a minimum of 1 to 1.5 inches of cushioned heels. Now, what to understand and which one to believe? Because I've been a fan of wearing flats all my life.
So the tendo Achilles, which is the ligament at the back, is actually relaxed when you have a little heel. So there is no right or wrong. Every lady's anatomy is different. There are some who are very comfortable because they've been brought up, they've worn heels all their life. They've worn flats all their life. And then when they start wearing heels, that's when they can get uncomfortable. So if you for the first 20, 30 years, school and all, you can't wear heels, you're in flats. And then when you start to go out for parties and you're wearing suddenly 4-inch or 5-inch heels, that's a problem. Your body is not tuned to taking that. So if you start doing that with a smaller heel and then gradually progressing to bigger ones, then it doesn't cause that much of pressure on the tendon at the back, the tendo Achilles.
So it's ideally recommended to have.
You can. There is nothing wrong with having 2 inches or 3 inches of heel as long as you're okay handling it.
All right. Thank you. Now, Mahalakshmi, please, let's hear it from you.
Which wasn't there earlier. So it's like a kadak, kadak, there's a kind of a weird sound the past 2 days that I've been having. So is that a cause of concern? Do I need to go and check it out, or is it something because I've pushed it a little bit?
Okay, so I'll ask you a few leading questions. Are you a regular badminton player, or did you just take this up recently?
No, I'm not a regular badminton player, but I am physically active in the sense I cycle and I run and I walk and stuff like that. So.
Prior to playing badminton, did you have any knee pain?
No.
Okay. And you look sort of young, so is it both knees or just one knee?
Both.
Okay. So typically there are two sides to knee problems. The one that is most commonly known is the osteoarthritis, which tends to occur in older people, okay, 50, 60 and beyond.
I am in my 50s.
Okay, so the other side is what we call patellofemoral, which is under the kneecap. Now that is something we see in young girls in their 20s and 30s, and that is an alignment issue of the kneecap. So with that, what happens is that there is abnormal wear and tear under the kneecap, but the major joint is fine. And this particularly causes problems while, say, squatting, or while, if they sit for 3 or 4 hours in a movie and then get up, the knee feels stiff. And that is associated with a little wear and tear under the kneecap, which causes these little creaks, grating sensation. You can sometimes hear it. Most often we tend to feel it. It's called crepitus. But if it's a very bad crepitus, you can actually hear it in a quiet room. Most people don't have pain when doing it. They only get pain when they are active with it. Say, for example, you're squatting or you're lunging, you're playing, yes. It's only a momentary situation. Once you start walking on level ground, you're fine. As of now, if you were to walk up to me and go back, you would have no pain. Am I right?
But there would be that sound.
Yeah, don't worry about that part. That part is a little wear and tear under your kneecap, which may be there on both sides. Nothing to be worried about. What we tend to counsel people like you with this thing is avoid forced knee bending, like sitting cross-legged, squatting and getting up. Yoga, they make you squat. So
I am a yoga instructor, so I'm always sitting.
Yeah. So you may have been doing that quite a lot, and that may add to the issues you have. So we say, you'd have to go a little slow with that. And then it'll settle. Once it settles, you work on building up the quads muscle, your thigh muscles, strengthen it, and that should help you.
So in fact, this was my next question that Dr. Manjula just now, she just mentioned that puberty hits us twice. Once we cross our 45s, we suddenly become young again, and these days the latest fad of doing all kinds of physical activities and, trying to cope up, which is good also. Strength training is Really important. But then, how aggressive can we go on our back and our knee?
So, there,
You can't hear?
can you hear me now? Oh, so I have to hold it a lot closer. Now, as I said earlier, everybody is different. I can show you people who are in their 60s, rather the young lady there, she said she's in her 50s. She's a yoga instructor. She's very physically fit. She can probably do more than most of us here can. She's now starting to have a little bit of knee pain, but with regards to backs, there's a certain place in town, I won't name it, but these people are known to make people lift heavy weights. 70 kg, 80 kg deadlifts, somebody who's in their 50s, 60s, they say, okay, we've decided that this is something we should try out. And they go, they make them lift it up. Puff, 2 days later, they end up in an orthopedic clinic saying, my back is caught up. It's nothing to worry about for the immediate thing. You just have to give them some muscle relaxants, anti-inflammatories, let them settle. But you have to take things based on your age and other parameters. You can't go lifting 60, 70 kgs if you're not used to it. If you're doing it on a regular basis, yes. So take care of your back. If you've got back issues, two things to remember are avoid lifting weights and bending forward. So you bend, pick up a suitcase from wherever you're traveling, yeah, it can lead to a slip disc and chronic back issues. If your back muscles are strong, that can be prevented. But how many of us do regular back strengthening exercises? We don't. We just go about our usual job. We are doing our work. We are doing our, household work or whatever work we are doing. And that itself is to some extent okay. But if you want to work more on your core strengthening exercises, you join a gym, you strengthen your muscles. You can lift much more than what you would think of lifting. We all lifted 20, 30 kgs of suitcases when we are traveling. So that's one, strengthening your muscles to prevent problems. Second thing is, with regards to knees, as I said, squatting and sitting cross-legged, try and avoid in those who have knee pain, existing knee pain. Otherwise, you could do whatever you wanted to.
A question which has come from the audience is that walking, running, and then walking and running on the treadmill. So it says that treadmill, walking and running affects the knees in the long run. Is it true? Because it's the most convenient way of walking.
Absolutely wrong. You can, anybody who has no knee pain or any other pains can walk miles. We all walk miles literally every day. If you've got a smartwatch or whatever it is, or a Fitbit, you will see 3-4 kilometers of walking every day.
But then walking or running on a treadmill.
Yeah, so walking on a treadmill is like walking on the regular ground. If you're doing it on an incline, that's a different thing. Then you need to have stronger quads muscles to compensate for that. So the level of incline is important. In treadmills, generally maybe about 20-30 degrees max, not really much more than that. But try going up a steep slope, 50 degrees, 40 degrees. Yeah, you're going to face thigh pain at the end of the day. We all do that, even if you're not used to it. But work on the muscles of your thigh. Walking on a treadmill, even if it's an incline, is not a problem. If you've got knee issues, then walk on flat, the treadmill being flat. How about taking the stairs down? For exercise, that's not recommended to do for exercise stairs. You walk on level ground or on an incline. But going up and down stairs, remember that when you're walking on stairs, at any given point of time, all your weight will be on one leg. So you're going to be pressurizing your leg abnormally. So as a form of exercise, we do not advise people to climb 50 flights of stairs up and down. In a cross trainer, both your feet are on it. You're doing that, whereas on the steps, one leg is completely offloaded. So to some extent, the cross trainer is okay. You can choose how long you're going to do it for and what the level of pressure would be. So they work differently.
The synovial fluid, which is in the knee joint, with age
comes down. So how can we take care of it?
Okay. So every joint in the body is lubricated, and the lubricant is synovial fluid. This fluid, I've aspirated hundreds and hundreds of knees, and every joint has about 5 ml of synovial fluid, which is the lubricant for the joint. That's what makes it smooth. Now, with age, you actually, because of arthritis, some people who have arthritis, the synovium liberates excessive synovial fluid. This is because it is trying to lubricate the joint excessively. So it actually produces more fluid. And this fluid, maybe 10, 15 cc, leads to swelling in the knees. So if you were to examine a patient who's got a swelling, that swelling is because of the increased production of synovial fluid, which is the lining of every joint. More typically seen in the knee joints because they are weight-bearing joints. You don't see it in the hip because the hip joint is a big joint and it's in the, it's covered up by a lot of muscles. So when there is excessive production of synovial fluid, it leads to excessive pain because the knee joint is not used to having more than 5 ml. So if you've got 20 ml, there will be pain because it pressurizes the nerves and the other structures. So it's a myth. It's not actually. Yeah, we've all had COVID. So some people do have, it's a virus. So it's well known that there are viral arthralgias, which means joint pains due to viral, you could get it with any virus. 8-10 years ago, you had chikungunya affecting half the people in Hyderabad, and people complained to me for 10 months, 12 months, saying, in spite of that, I still have joint pains. It settles down. It's a matter of time. Some people 6 months, some people a year, some people even more than that. Now, we'll have to evaluate to see. You can't link it and say it's only COVID. There may be another reason for it, and that has sort of coincidentally occurred. So that will need to be clinically examined, maybe even radiographs. But don't think that COVID causes everything that's there in somebody's body. Yeah, we're seeing it a lot now. It's called avascular necrosis. This was typically seen, before COVID, we used to see it in those patients. Most of the, it's usually idiopathic, which means that there is no reason for it. But there are also reasons such as, alcohol and, steroid use and, even diving, deep sea diving, gout, these things cause avascular necrosis. Essentially, it means that the ball of the hip is dying because of a lack of blood supply and because of the increased pressure in it. So when we take a history of the patient, they may have had steroids or alcoholism. This is the two most common conditions in India. Now the COVID hip is seen in patients who have not had steroids and in those who have got steroids. Now those who have had steroids, maybe 70-80% would have had steroids. That was life-saving for them. But avascular necrosis occurs. But there are some patients who have not had steroids at all, but still develop avascular necrosis. Now, is this idiopathic or is it due to COVID? We don't know the answer to that. So we have to, so people assume that every case of avascular necrosis is due to COVID. What about those who had it before that? Yeah, so most of the time we attribute it to steroid use, but is it because of the virus itself? Is it because of the vaccine? We don't, nobody knows. There's research going on, so we don't know the correct answer, but yes, you're right. We are seeing it more than before. Invariably, all avascular necrosis, it's a matter of time before a patient has a hip replacement. It's just a matter of time. It may be 10 years, it may be 15 years, but every avascular necrosis ultimately ends up with a total hip replacement. But in the early stages, stage 1, stage 2, the treatments are basically calcium, vitamin D, alendronate, which basically hardens the bone up. There is no restriction on weight bearing. Most patients can't squat in any case. And then we go on to what we call as a decompression, which means that we drill the bone to decrease the pressure, and at the same time we add some stuff into it, such as stem cell treatment or a regrow, or there are other things that we do for a treatment. And in the final stage, when the hip joint becomes arthritic, we do a hip replacement. As a precaution or as a treatment. So I'll give you both scenarios. You've got a 70-year-old lady who's got bad arthritis of the knee, whose knee buckles. Now what happens when somebody is walking about with a knee that's buckling once in a while is that they fall and they end up with a fracture of the hip or the shoulder or the wrist, depending on what area they fall on. So the kneecap is just to prevent the knee from buckling. We advise that for those who are unstable. Either a stick, which most people don't want to be seen with, or you wear kneecaps because it's under the sari or it's under your whatever you're wearing. Now, as a precaution for those who are doing, say, lifting weights, you see weightlifters, they wear braces and they lift weights, or a belt. It's a precaution for them. Otherwise, young people, you don't need to worry about using a kneecap while exercising. You don't need to.
I have a small request. Once we open for high tea, personal questions can be asked that time. Okay. We'll do generic ones right now.
I'll just take this one so that I've started. If you have an instability problem and your knee is buckling, then we have to evaluate that and assess to see whether you have a ligament injury. If you don't have instability and you are pretty strong walking, it's just pain, you don't really need a kneecap. You just need to strengthen your muscles.
That will be the last question for the evening.
Yeah. Doctor, I have two questions. One is for this side, sir. Yeah. Do you have any treatment that you suggest for frozen shoulder? Any medicine, or is just the physiotherapy?
Oh, that's a huge topic on its own.
Okay.
Frozen shoulder is most likely linked to diabetes, so we have to evaluate that. Sugar control.
No medicines for that?
Medicines don't help, it's physiotherapy.
Okay, the second question is for calcium additives after 40, 50s. These almonds, flax seeds, all these dietary things are enough, or you need to have a calcium additive also?
See, generally
for bone
health. Generally speaking, most people don't require calcium until they are really old. Now, what's really old? I know people who refuse to take calcium who are in their 60s, 70s. All you need to do is just be active and healthy, and that itself is nourishment of the bone. A lot of the blood supply of the bone comes from the muscles. So if your muscles are active, you don't need calcium supplements. Whatever calcium you're getting in your diet is more than enough. But if you're worried or you have a genetic, say a family history of osteoporosis, there is no harm in women post-menopausal starting calcium. And men post-50.
We'll take a few more questions because people want to ask. Yeah, please go ahead. Yes, surely.
No, she's asking a question. Yeah, Monica, go ahead.
Is it okay for the knees? And another question is, how is physiotherapy for, relaxing muscles?
So, we don't often, should I do the second question first? We don't often do physiotherapy. We just sitting, getting up, walking 3-4 kilometers a day and getting back to our routine. If there is an issue with the knee, yes, there are certain indications for physiotherapy, like ligament injuries, like post-surgery, yeah, those can be addressed. But otherwise, any normal person does not require formal physiotherapy. Your first question, absolutely, yeah. As long as you're capable of running, there is nobody to hit. No. The wear and tear is generally a genetic thing. Okay? I'll show you 80-year-olds who still run. There's no issue for them.
But she's right. There are a lot of papers which say too much of running can lead to the cartilage getting depleted.
Yeah, it depends on how you're running and what. Sometimes you're running on the road and you've got a pothole and your foot lands awkwardly and then you injure your knee. Then you have a little bit of a cartilage, a spot in the cartilage which sets off a cycle of arthritis. So you need to watch where you're running and how you're running, proper shoes, and it should be nice and flat. So that you've got to watch. So running itself can set it off if you've had a bad day. But otherwise, if you're 50, 60 and you want to run, but you don't have to run like Ben Johnson. You can run at your own pace.
Yes, please go ahead.
Cramps in calf. Cramps. I often get cramps in my calf muscle.
Yeah. So
yes.
your question is that you have...
I get cramps.
Cramps.
Yeah.
That can be orthopedic or even non-orthopedic. People who are taking cholesterol-lowering drugs can also develop calf cramps. So it's more than just one specialty involved here. It may be due to low vitamin D also. Your muscles can be fatigued. So we have to evaluate, is there a reason for calf pain? Is it something to do with tightness of the calf muscle, something to do with your tendon, something to do with an injury, say if it's one-sided? But invariably, both sides is something else that needs to be evaluated. And in our practice, a lot of the cholesterol medications that are given do cause calf cramps.
Arsha, you can go ahead.
So nowadays, a lot of boys, young boys, our sons, and in my case, my husband, are gamers. So they game and then they don't move both their hands too much. It's just 2-3 keys. So my husband 2 years ago had a little bit of a wrist surgery, and we were told it was because of the gaming and you just have your wrist like that, and there was some sort of problem there. Is that true? Because a lot of people told me, nahi, aisa nahi hota hai. Nothing to do with the gaming.
Yeah. So that's a good question because, when there were Blackberries in the Blackberry phone, it was a very novel device because it had a keyboard. It was not like the smartphones. It had a keyboard, and you would have to use both your thumbs at the same time to type. So these people developed what's called as a carpometacarpal arthritis. That is wear and tear at this joint at the thumb. They were all young, 30s, 40s. They were doing a lot of these typing which they were not used to earlier. And that can lead to a repetitive stress injury to this thumb area. That's a different condition. The second is what we call as a tenosynovitis. That is what we call decurving tenosynovitis, which is an inflammation of the tendons just behind the thumb area. And that also can be due to a constant use of the thumbs. That's the most common thing to be injured in the hand, the thumb. That's because the thumb is used for everything. All other fingers are if you want to touch your fingers, the thumb is the one that touches all the others. And the first thing that you do is, when you want to grip, is when you want to hold with the thumb. So that's the most likely injured site. Yeah. You can't play for hours on end. They have to take breaks. So it's not wrong to play, but not...
Without taking a break is what you think could be the problem.
Is not recommended. Right. Similarly, sitting in front of a computer and working for 8 hours, 7 hours is also not recommended.
Any more questions? Yeah. Give it to her.
Is there a test that we could do for arthritis or osteoporosis, like a preventive one?
Yeah, so as we grow older, and if you have knee pain, yes, a routine X-ray is all that you need, along with a clinical examination. For osteoporosis, as I said, for women postmenopausal, it's not wrong to take calcium. Vitamin D, of course, we all need to take it. But there is a DEXA scan which is done, which shows what the level of osteoporosis is, based on which we can suggest medication. Oh yes, not only hereditary, but they're also linked to diet, they're linked to, what? See, we start off with calcium, vitamin D, some something like what we call bisphosphonates, and then progress to 6-month injections and even a daily injection, which can be for very severe osteoporosis. But that you see in in people who are, very elderly, 80s, hardly active. And as I said, as long as you're active, you don't have to worry. The moment you lose your activity and you're very, very sedentary, that's where osteoporosis hits really hard. And it is reversible if you recognize it early and you treat them, but you have to treat them with the top of the line medications. As I said, there is a daily injection which has to be done, and that up to 2 years can certainly improve their pain by more than 50%. Of course, there are side effects to every single medicine, but it depends. It's like a balance. Is it better, or can the patient cope with it? So we have to do a few tests and evaluate whether the patient can take those medications or not. But those are in extreme situations. See, rest is rust. The moment you start resting, you end up with more osteoporosis. So never ever be inactive. Be active for as long as you're capable, and your muscles will be stronger, and that in turn will nourish your bone. So your osteoporosis is...
Thank you, doctor, for the personal and generic answers to all their queries. Thanks a lot. Requesting Shweta Agarwal to get the autograph sheet signed. Also requesting Vice Chair Ms. Aparna Reddy to deliver her vote of thanks. Thank you, doctor.
Thank you. Thank you for the invite, Shubhra.
Good health is our greatest asset, and today's healthcare conclave was very informative, and we take back a lot of learning about our health. Flo would like to thank Dr. Karthik Pingal, Dr. P. Raghuram, Ms. Chavi Mittal Hussain, Dr. Manjula Anagani, and Dr. Jayashree Sharad. Today's platinum sponsor, Argent Amarts, diamond sponsor, Freedom Healthy Oil, creative partner, RBC, hospitality partner, the Park Hotel, the media, and all the guests present here today. Thank you.